those who never returned. Tides turn, seasons change. We've waited and we've watched. But we've always been here. We've always listened. Because there is a different resonance here. It comes from the river, and the land, and the sky.
It's our place, all of us.
This city belongs to everyone.
And you know when it's your time.
And it's our time.
Listen, we are Freetown.
We are Freetown!
The golden rules of Freetown.
Don't pretend you're something that you're not.
Don't go thinking you're better than anyone else,
or that anyone else is better than you.
Don't shout about it. Get on with it.
We are Freetown.
Freetown.
Freetown!
Yeah!
We found our voice again.
I'm from India and Freetown.
I'm from China and Freetown.
I'm from the UK and Freetown.
I am from Nigeria and Freetown.
I am from home and Freetown.
This city belongs to everyone.
The fishermen,
the taxi driver,
the barber,
the drummers, the dancers.
All of us.
All of us. Everybody. We are Freetown.
The past is ours.
The future is ours. It's our time again.
And this city belongs to everyone.
The playwright,
the greengrocer,
the teacher,
the dog.
This space is ours.
This light is ours.
The beaches are ours.
The rivers now we own.
The roads are ours.
The bridges now we own.
We are Freetown.
We are all visitors and we've all been here forever.
We've got the mightiest river.
And the biggest sky.
And there's a resonance again.
Freetown. Freetown.
We are proud of this place.
We love this city.
And we want you to love it too.
We are proud of this place.
Na pass we all dey pass like stranger dem, but we all don't dare from them. Come here, and you'll feel it, that end of the line sense of freedom. Say yes to Freetown. Say yes to freedom.
Wa Slbc Tv ngwatesi aba nyame Ibrahim Kumango adwe mbenga ma kepingo dokumabeng gabeta yebu musi andam ya kutumawe na havele mufumalama ta ajia na wehi sada bro atita tugwa na tugwa giti ya kolwe metro ki kokusiama na we koku na sia ko weta bi ngate ya hakesia huma na we te gujele lo hi aba kuima ye jinu bogo mauya ko we ya ta ya no ko wa sia te ya fi hakesia meyo kebebi ya na we tina Freetown player sia tugwa na ta tuku ya te da ba na we fu ya ta kugo be a phone bogo mahunku na we fu ji ta ka utima be na do ko fe Jia na we hi sada bro atita tibega na do e yipikishia madunya kupe na we hi fui tada ba ye fui jiga otiba na we tutu ma amejo kokusia ye fui sia sia yo taguta ya gauti hakisia ta ya ho to ye hu batiji gu hungi te ya mino na tibeke tugulo na kuwe a 400 ya kanu flavor ko ma pugu na we ye ko na tabite gu ti sign ko wita bi ye hu batiji sia ogu ola na to hu lo mi Paris na wita sia ngata ya hakisia tamejo to ti amelo na te de ku hunju na we ye fu ejita pe te de hi ba ko witi ga oti World Metrology Day na wita ko we te ya hakisia na wita ya huma te guti da lo kuma gabuju ye jinu bobo ma hunji ya fuju hu na we ji atna ko we te gu i ngate sia te da lo kuma sia ngata ya hakisia huma fi go hande sia agu ola kuma dueju to ye ngate jigu hunje executive director na we in Salo Standard Bureau ngate sia ba Dr. John Paul Kaisamba ogulo na ta ogu ba gite ya yiku hunju ko we ye ngate jima ye na we ta ye hande sia tugulo te higo to ko ma agia na hebisia ko we sia ngata ya hakisia ta ya huma na we fi go ba bisia ma ogu ola kuma dueju to ye ngate jigu Deputy Minister na we na fi hindi siya ba Fatima kama ogulo na ta oguba gite ya yiku hunju ko we Standard Bureau na we ngate gita bi tu kuma ta da kuma ko we ti gutu ko ma committee nyanki na committee ne mo na we ta diploma handi kia ogukola kuma bi pada doe to ye ko lo hunje ya na we hi Freetown player ate tugwa na tufu ya na wete da hi ba yifu na gidi na sia kini te pia kuko be a phone free go na we yifu gita tugwa te ga utia ko we yange hindi sia ma te da ma kuma duwe ye kome wa gita to we lo miado National Peace Museum ngba te sia na weta gia tena yange hindi sia ba ke be bi vage ba sia ma na we na kodi hindi sia ba na we ti beta tugulo te gutugoma ye hu batiji tukwe bitia to ye hu batiji gu hunje gu mwe na we na Freetown player hu batisi ya ba chali hafna ogulo na ta ogbo bitia yu hunju ko lui ye hu batiji siama na we fu jita bieti ga uche ye an basu gu bita na melo ade ye siabe ye hu batiji ye ni le afu jita hi ga uti ba ye kubolot da ngati ne mo ya funi disia ati yetugo to ko yitugo na we sia be bi tele bu ko disia sia ogukola kuma doe hu ke be bi hande na sia na we anganya wo ko tuyo ba ko we ye disia sia me tugo to da kuma yange disia na we ko di ba disia ma dia ta gu sia ya ko di sia ti pe ti ye yo ba ti sia ma ko we tugo to da kuma o ma ye doe di to ye hu ba ti sia imara ko hu te ameno na te de ke sia wo to a ye hu ba te jo 1980 na we ye hu ba te ta tuku la gite ya ko we ta bi tuku te da ga ye na we yange ba bi di sia ma na we ye de sia agu la kuma ko we nga te le hu di sia ko la kuma do e to ye ko lo hu je atna na we hi gubla atisa ba te de sia ma palmetin tugwa na tatuluma ko we just the Fatimata Bintu Al-Hadi na wita ogu oya yige Supreme Court no bido doejo to ye numuje na we hi YouTube mi start fi agwe eyewo ayige abi court judge na wita ayige ro kugo a phone gogo na we ko we sa bate ndi kekia ogu ola kuma doejo awati na to gu yutulu kulu yima gumwe na we na committee business mbatesi aba kebe chairman na we na committee appointment mbatesi aba honorable Martin Yuma ogulo na ta go kwa kiti ya yuko hunju ko le gumuji mana we hintulo kuluka kama ko we ya ige sa bate ngisi ya tia vi tabula tata lokuma na we ta diploma handi ya ogulo lokuma ya melo ode yuko hunju ye to me get if ya hingwa ye tala we agi na we hingige we na sia kini ya hi sa bate ngisi ya ba ko we ye de jisia be to ko ta lokuma o ti asize handa o mai doejima to ye mbatiji bu hunji tiana to lokolo ye mahi ja na we hitna politika mbatesi aba na we hit bete ye mbatiju to me ye te fia ya kuju ko we ta be o ye de ape na sia we hi sa hande sia agukola lokuma doe just Fatimata bintu Alhabi na we ta mumia ya agi lecturer mi agi mialo salon loss Lucia na we ta ke potwa apia hi high court mbatesi aba ko we ta bi sa nge kiasia sia tabula tada lokuma opo mai doejima to ye mbateji ku nki sia imala ko jana na we hi parliamentary secretary of a Ministry of Communication and Innovation Technology mbatesi aba tugwa na tugu bwa keti ya ko we mbatesi aba na we na computer mbatesi ya ko we ta bi na we ta tugu te gege hete sia agukola lokuma digital ba bi ma na we committee isi ya ko we mbatesi sia agukola lokuma doe to ye mbatesi ku hunji gumui na we na ye mbatesi ba Slbc commander ogulo na ta ogbo ageti ya miado new buffet yo hotel wa na we hi ye pe ji sia tugu te de kuma ye document mbatesi ya ko we ta bi sia tagula bi ogu ala lokuma computer mbatesi ya to ya miro ade ku hunju ya na we ta bi ye mbatesi di te de lo lokuma ko we ta bi gege hende sia abi technology ba ma ye ki apio gege hende sia ye bebe na we ta bi ende na sia kweta ku abuya ogu ala lokuma wedu awati na ye mbatesi makuhu ya na we hi bla ati kwete ye mbatesi ti amiro na te pe ye mbatesi ba ko lui ye hende jima ko we ta bi computer hende sia tabula te dala lokuma na we gege hende na sia abi hi buyu ba be ndaga kini ayema ko we ye hende sia kwete da bi kengele na we ye hende sia computer ye hende sia ogola lokuma technology ba bima committee ye sia hende na sia na ta goyo ko we ti butuku aboya te da lokuma ogo mai duwe ma ye bele ke dile ye duwe bodi sia gimi have le bufu ya uma oboma Slbc TV mbateba ana sia na me ogbo ma ne bubu akema na ha beta ye gu sia le ga ya ma beta wo ne mo ta agi ji atna na we ni standard bureau ati tuwa na to 4 year ya wo tia na we fu na ta dunya ku pe tu be rotma tia ta ha ke sia mo na we ta te ya me rotide ke gawi ju na we hi ye jinu bo ko ma ho ya ta se ya mama tu fo ya ma ke po wai handa ko ba te sia ba ko we sia ko pina sia ta ya ga yi fi ndi sia ke be bi ya na we hi Freetown player ati na we ta tu bo na tu fu ya wo tia ya ana ba su ko mi tu wo be a fo no fle bo na we diploma handi sia da ko la ta ma do e buri sia jimi ha vele oboma Slbc TV ko ba te sia ba nyamia Ibrahim kuma gudwe obenga ke amalo akamisa bima
iko ika basane bafo hakira kaki yake muna Sierra Leone Broadcasting Corporation television ni deminen aluseni anamis singa kaklika ata atisale ka standard ngani ambo ka kapai benchi ai poti apula tu ni yengi atatu ko kane ka mo pa ko mai kala kati ni ka ai ta ala loko kati sai ani kinyi ni ana ta sala Freetown players ani ani kinyi na ai pia ko pa sha pa pengen ko from ka no camp ni kama ni atwa sai antene ni ke mambo ba signa ti ba signa na ya ma pa ni na kabi ka to ha ka ofilawati kaka asa len standard bi ngani apopo to na I odo usata kaya dine ali ani abo trapya ka klima ya tuto treye tsame ma ho kane aluka ngata nangi ni beta kakale kama kutut kafino ki ta from sope ati mayo tene kaya tene mi tsmata mami bibe mi kina ki ngabi ka tsina tsi tsigin keme kin tsikatsin sofoti mayo mi tsmo mi dibe di tabi kabika tsofoti tsfina mala tspe pai ka to falu fa su paris wali kabutusna tsfina yet ati duko ka mai tsmute mi buka ati akaso bika ka amitsmati ni mama yakine mai libeli akaso bika kofa ke ka amufunga bapu amufanyi kaba ka tinge ka yin ka aba aki kai tiktok ko kana epote epula so ine ka ma kitstope ka onto buka ti katama pati so ma yo tsamo tsangi tiba tkana kama tsfina tsbeli bimo ka kulum anto e utse fina kama katon ka tira ukukati otoris kalo Sierra Leone standard bureau mo Dr. John Paul Kaisama kono so convent ka ko paki ko fina o nan ka panga ko tunti o ngata yang pa fina be ka e utse sia katira ukukati o ipato okapo ka kim keme e utse sia katira mo Fatima ta kama ko ya tsi shank an kraki ayang standard view salata atinga yo ten ko ka salana nga ka kwamenti ampo utenga salata ka upenga kayo kama ambasu yo patami afina ani ki ai anata tela Freetown players ani ki ngan kana ka pipi ampo bashi ya bapange ya boy ko kama patma it ami ngani ampo yo kama ini ati ne ka ani kenge Opo ba si na si tseba tsiri ni ka kaya tina amitsmate ni di lago di sata afama banana mo ampuli afama sakota ato I angin botu amitsami afama I ma chichi yoi sa tsari na ti tapu tasatani di beli aku yo motane matani kado National Peace Mission ukukatsu kukati asataka otsupika ani kinga Freetown player mo Charlie Hafna kono so kota ma kapa o naka tinga ma yo teni pia mo kapa tuku tsoibu afungu tinga apu hiloi chokulu tati ke ai ma kama afun kiso ma yim chengai kama na so anta chokulu anto I ankulu nga kans kama anto I mai ma tene kami kabika ko fake ko fino ka e pa se bakasa tema so pa ai ma kama fume pusokna Epo samo kaling anto I macam mulame kama tsaichina tsbeli ete pi tisha tgasya bapanya boli kom ka ebakatse so anto ka so ka so intini ka amitsma teme la putli mitsami mukbati anto I pa hi ekwate kumpe bati ka ku bani ka amitsma teme kini kocho I kata ko ibe tsakana kama aben pa kofu aki kocho ka amitsma teme bibe dia pa isho ala tsi ka ya mani nga na ti ka ebuti sia ti tati ngoyo ya fuma im tshare ska mi tsante me nga so atela nga e kama kusa santo tu na lata sta santo no ki bibi antio tati fino moti bibe di ka pa na ka ni ani so pa na ngi pi ante suma ka ko fina ata ka so chori saf ma pati atati nga santi tare Kashi tabana be duma putse yimo parliamenti o ani ampo bend ikobun pikin yimo otunka satmata pintu alhaleni o salata dabana de afu sonko koku tokanko tabana atela an Supreme Court kano tontofi oku wompovi kono ba ya appeal court judge opo kaso bashi tirin bai ka mapantma e para kotunkas ali ka so tsoi yet ati konani okuyo antono ki masumo ko ka Supreme Court ka so tsoi ko pa amesiet ame asumo salata katiknang angi aiti kusumo ka Supreme Court papo klikli akibu koni pimo di dan ka pa obo yo tsati finani pimo okubunka ebutisa ankwamente pana ka soiso opa kwa kan committee on appointment kan fuma titi mo honorable machinyo ma kobi ka of kase ke ka mafu kli ka amisami asumoi aisa fina chinga ato I akibu ka ndi dan ka pa kono ni kono ichi ke ba mabdaba na datse di be di au kane payate ka duma bo tik tik di kama sumo ko ida banari di so afma banari tamin kane uti sate ni na so kan kui ko salata ti yets ko ni opui anome abo kabane am pat mama fino ni ami ka paya ko tu kasi ko mo justice Fatimata Bintu Al-Harini kono so ko ikamo ko ka do Sierra Leone Law School diwe di do la tpi anto ma ko so yo te fino ni ka e butisa e ko ti ko no pu mo do high court anto le court of appeal mo to no ki mo ko I to do Supreme Court. Okay, for me, a permanent secretary, Kaka came can able to say, Anto Imakala Mufu, Anto technology, so Coco so Lumi, Skakli, Kabi Kampana, computer Kapai, or any Kawakane, if I take a tomato bay, or any panga, any tree, a boy of finance, discuss a woman, and Kwame Sating and Yimakani, or Okabo, Pori, most TVC, Kamana, and Coco Pata Kiki, Orika Kyoko, Vama Panema, Akuyo Kadu New Book, Fish, Cherry. Kaya mani aku bend epa iti aku ucayani ka aluka nga antal mga titikog na cuma bucay at timi-tafina ka ay bucay sa tayani okay bung pagi kakasabi kayo kakafaki kafina tipi chichoy na kaafum at sa ang kulong nga kaya alane komputari alida ka nga tanga kakaso so taliyak mabana so mo uwi mai kame kono soy kakasabi kayo kakafaki kafina so kapangay ngayon sa nakama kulub kebali kado yo poyo do afamay ngani mayo at ngani kabi ko ngani at ka so ginki so makumo kumanto I mal small mi ame ma checho ka tanato tatetsani wa di aka so choi so ti ai ma kamau kane kuka tinga amponan kalfori kai kama bika ifamo yani kanka so choi atsai tatsi ai ti kialane libet kanki ti kama ti tai ti mi tafino mau kare ka pa ya Atamatoi kadi matong akerai awala ma kai antine ai ani abut papia ka ebutisa matsai shek ami matunte tati Sierra Leone Standard Bureau ngangi abu akerai kan kapaka papua kabakati muri kuba inka abai aki kai ti ku kane to hit poti apu choina kai ya ti ku kane loko kati so ani kini nani atela Freetown players di nga kaya tine ani kemo po ba tigin ati tigini ali so kabi ka takulu atinga ni apoyo kabi nga malat papat matene kaya nalata na kiyo na Sierra Leone Broadcasting Corporation television lusina na misite pato
Herba obi asia ba ken sumang ko isi masilma ngata sumita ka Slbc ami bungana na isi masilma abana wakila ko to ntina ikati peta ko de tare de kai ko po bi de na Standard Bureau de mun suma wali makena menga para ba katra portal de ni conta ka yang to me na de sete maneni conta ka imante ko po bi na fitunia de sega taba te ba kon katsena no ya li ba kena me manga ken kudo Papunka yeri samalo masiti na nye konto kanan kadunya baka samo matro ma hawa ndiga ko kabeni mama mbeni ba hena bikona ro wa masir ma kuntema upobre na Sierra Leone Standard Bureau de siga tabanti ba to tiono kwere kunda fuma ba ko kasimo malo mama upo amuna nekti beni ba mutu se ba beni ba oni ba kwere ko kasi ndiga tabanti ka kwere hu gibinde ba ndiga tabanti ma wali kamalo ma mante in bia ba ko bana fe kanina hamba ni wonte te kai kabeni mbata kopta bile se mariti bi hawa ni ka kwere ko ba na bile se te mati ma kena memba ni na tabang ba ko kan na tano na be paye beni ba mo wali ma mete ba kata ma sete ba boni be imba bo imi ka kwere ko ba na gula na ni ma sete no ba ka sa mo ba kena memba ka ko so Executive Director kwere ko la salon ka ko Standard Bureau Dr. John Paul Kaisamba de Punko no beni ba mutu semu ka beni ba ko wana ben kaya koso akwenku ba nyo pa ha ima wali mamete ba halu lasiba akwenku ba ba ko kaluna mame ba katra ba ko ni bana ben kaya koso akwenku ba Minister beni ba ko ni ba akwenku Fatmata Kamara de Tima Mono, Massively Mamma Mandi by Catrabaca and Candy, non capo Kenema will on a standard view by the day, Nabel Numassi, Bapuka, the ticket of Quaments and Banema, Wally Mamandi by Hallow upon Banabe Kayako to a quay. Pandayo back to Massi Marco to a problem of some prayers. The Detekai non Capo Kare, Basse from Wally Mamandi by Catrabari by Hagwande, Canable Seti. I name contact come and buy it some wali mama bani back at a query and cook to it. Casal said that I went to buy it some low mamma, no cap even the Makutanimanka National Peace Museum, Cassi Negatabante, no, Victory my Troy Markenamen, a bidon about Palo and Bapa and San Masiri Mabing, Beniba Nami, me baby said Temem, Makui Mama, Nancy taking it I name contact canam, but Halwana Black Royal, by Hawan, the Bapu Katsuna. No lasiba kwele nkumba ni mahaganduma kana mleke ya koto de kitema wali mama bawendeo kakboga Freetown players Charlie half na le kunkui non kapon hamba ni ba mayatima setibinde ba kuka simo non kamalo matowe ba halu na bele tikai ga bia bitone na koto bas dete na bele note na mi kentunde ena bele seruti ba halu na bele dete na maya na ya ni mama kai ga koto de dugela punka inkantimo ba ni mahaganduma ba sembe ba na blesse tema ko ma keneme inka pokitsani non petemba kekari ba kungaisa mateben isawonte non kabetsi ba hawa ndiga ko kumbani kama kutsani mabu ibine mambi wondi tikai non kananye na kentuna matroe ma hawa ndiga tu nibinde kama lo matowe emise atabante bimba yesa malo mama kabile kukiturege pato na matoi makena me imba isawala na limatite non kabimpo benda ba sekta no na mi bikeni tentumbe ba kasabeni ba yali ba kentu ba ko enkumba ka kotwe ka po se na tabante non kai binde ma wali mama ngani na wa 1980 ka se tibinde non bise tabante be ka pubide bwe wali mama ndi non pete ma binde ne kahe ba yali ba hagwande ba sala tabante ba kunkanye wali kai no mo kunde turege kabile de masir ma kunte ba kunkatana no la siba ko en kumba penti ba pasi tunya ko tsunambe ba katsima wali mama parliament ne se tabante ya lunde binde mayugo ba no mawali ma simila tabante justice fasma sabintu alhali de kunko non ka bia bi tobe ba katsima wali mama ba ni ga kotwe kabeni ba sebine le secretary konto kai gana sitene makui mama wali maga court of appeal abaton kan yunda koto no atalo liti beni bana wo kunko iso kana wo nduku mame o lisatu kumame kabeni mama foma na wona ni yere me sete makui mama ka sitena le madongi makena ma non ka kupasu tante gunda ba sete makui ma bena ken kudukali kana yeto le ba no mawali mama bani bakala wa koto no wa kwa mensa wa beni ba poni bang kana setele makuri ma ba podo wa koto wa committee ka no beni ba yetu ba honore mati nyuma kunku ile no makuri ma setele ma ka beni mbande ni banka ko egen ko ka na de katima wali mama bani la koto e ka no beni ba no ndi bang ba seta makuri mama bani sega ta banti ba ko kasisina ba hantu na be te kai ga beni ba no ni ba na ben kai ga koto wa ko egen ko kama kusani mambo ibine no na binde tenkitima wali mama ka beni mbaga toki ano ndi mbaga kwegen ko titsanda kana henga hawa ndiga tsoli bine kan kuna ka onde yeto mba seta makuri mama ka beni mba soli bine kano na binde katima wali mama bani ga koto Justice Fatima Tabinta alhadi de kukoi non wona hello oni lecture ga karante ga beni mbaga siran ba kwegen ko le helen sete makuri helen kabeni mbaga nondi mbang ka basi unatego kanon ka basi bude dongo na court of appeal ka se tatsewenta de ko ka wodun kuma me ga sande dumuni ma me no basi utantero de na sete makuri mamba ni foma kanon kama yetu ngadu de mamba ka sanon kwere kumbani la koto mana yalo bata na masiri mam permanent sexy wa para uniti beni ba masiri kama wali ma nama ni technology ga sisi bine non ka beni ba compete me ba na bine me puke ise ba na wali no na mde kati wali ma kwa menti ala kwere kumbani la koto ona koto Steve Sim Kamada de Mukoi non kama seri ma du de ma kama kusa de ma bu ne ka New Fis Hotel ka se le tabante pa pukatia sara non kutapa mutu bi ne ba tema seri ma kename halu na mawali mama na men kai ra ko to aprenku kama seri ma du tu ne ma pada non ka pele de bi ne ba ka se ga tabante ba nya mawali mai woi pensin ka beni ba kwa met na men kai ra ko to ne he mo Steve ndiga ko ka ko renko ba halu na bi ne wali kabeni bayo e wa katano mawali makena me makapotra ble dunde ako imate na meni masonya kabila bisera tabante be e wa kumbo izma kutandi mama kama wali ma mete in kasa beni ba tonko nyoga ko benana na men kaiga kotsoi e duga ko kiara beni ba sekte bine ba sa tabante kama wali ma beni leti tsanda ka kweren ko da maseri ma bile sikaiga kwa menti han imbi ni wali kai ga beni ba hena ma bile mensi kai ga kompita na meni ma sonya ka beni ba ni ba kai ga kwa menti no yes bebe titanga bini wali kai ga kwa menti ya ka beni ba li tsali beni ba fo ma bile si ba ta menti ba ka tsakwele kwa kotso tena pina masirma yamba helen ka ke ko ele bina pe ta ko renta ele kai ana se bina ta ba ti ba ku ka simo ma lo ma ga wall measurement de ba la si ba ko en kumba e samasi mama mbali kana ya ndo misete maleni kontokaye e mate kanina hambani o pobre do ham afritonias le serata ba te ba ko katona no yali ba kena memba ka pele kumba ni ga isimne na sititene en kontokana kadunia ba kasabeni ba na mu memba ko tsoka ko en ku tena pina masema ona dona ingabi na fuma ya amidumbia hana dumbe kamive
Slbc Tv Freetown, from Bologna Money, no this na the use Mika Fino Kono, but Osmeka Guna the big use. Standard Bureau announced by force all man for begin use the measurements to from Wednesday, May 21. And one of Freetown, the most concert group when a Freetown player, they celebrate 40 years. Now, not for the newspaper one. The Salon Standard Bureau don't join other country then community then for member world metrology and measurements dependent team measurements for all times for all people. This year's celebration will mark the 150 year for when them signed the metric convention inside Paris. The treaty them put for international cooperation and for measurement standard. The biggest topic we've been inside where they remember this day, another ceremony day for the World Meteorological Day. Now for make they announce say for May 21 this year, the cup them where them for begin use, then will make sure say all them cup then they now all the markets all about inside the country, and this now for make sure say all man gets equal share. It clear for all man, make it all man see. And for Seka, the customer then we go to buy them thing they are with the deal the measurements cup. The executive director for Standard Bureau, Dr. John Paul Kaisamba, say this measurement are the backbone for make all man get equal share and it good for all man we tap na the different society here. The Deputy Minister for Trade and Industry, Fatima Takama, tell think for this kind of a step with Standard Bureau don't take and talk and skanga one say governments don't ready for gain safe for make sure say then different markets they yasu within the sell come up to standard as then they use them the yasu. Freetown players now one of Freetown the most concert group we don't celebrate 40 year. This celebration yeah, so then be all of the National Peace Museum usai them been bring plenty artists, journalists, culture party them for member inside 20 years we don't pass and the kind of good work where them been done they do inside the country according to the founder for Freetown Players Charlie Afner. Then goal not to for celebrate waiting they don't do no more but for serious so give for serious so inspire young people then for make them come on board and make them self-help for put on and support cultural expression and make social change. Charlie Afna continues to talk say they want to make them understand where they act concert it solve some kind of a problem the way and it will make unity then at the different community with one word usai in tap. The events been show different kind of sing the way they mean sing and they mean series so act some concerts them way for show the road them way Freetown player Bido Waka. The audience then serve them in gladly for this kind of a thing way then show them and talk say this will make the sense we then get able for lock the old way day between different generation them. The group being get a name inside 1980 where them they get attainment to people them and then succeed for make sure say the kind of a thing the way them they do and show inside them concert not for entertain people but they use them as tool for pass information and make people learn and sabi plenty in them. Parliament don't agree and approve Justice Fatmata Bintu Al-Hadi after we them in Pickham for make a go work na Supreme Court of Salon. The first time appeal court judge don't get over 20 year law capacence and now the only woman judge we right now they sit down na the Supreme Court when them present Justice Fatmata Bintu Al-Hadi for make them pick up the leader for government business when I say so the chairman for the committee for people then Honorable Matthew Newman say Justice Fatmata Bintu Al-Hadi na person we get good track record and a person we get respect for the work we they do na in legal and corporate sector we make plenty people talk say disappointment here so and for sake away they give safe to the justice system and now with the respect way it gets make then give disappointment when them they talk na the group but also approve Justice Fatmata Al-Hadi. The law people are all about being talk about the good thing them way Justice Fatmata Al-Hadi don't do and they admire for in footprint where it all left na the sands of time during the time where they do they work na the legal and corporate sector. Justice Fatmata Bintu Al-Hadi na lecturer na the Salon Law School. He don't go through the different rank them inside justice system from High Court to Court of Appeal. Now it all reach na Supreme Court. The permanent secretary na the Ministry of Communication and Innovation with Technology don't talk say the computer system framework for digital service na key important thing wey go help for make people then see the kind of good work where governments on they do and different thing them. Stephen Sim Commander be the talk this na the new Brookfields Hotel during the time where them in the look inside the documents them. It talk say the inside anything when a unified system for efficient public service. Stephen said the country will more pan technology and service will help for reach the kind of a level where digital business for do and go upgrade them different in the way they want for do. During where they talk about the group and other speaker them together with the consultant and talk say this framework also go help them for make it clear all man see what they do. It go reduce corruption and go say so left example for sure say then they build one unified data together with public service. Some of the recommendation them within inside within them in vendor they mean game for make their look inside and some parenting there now for make sure say them put to law pan national data governance like data where them will shape na computer system them all about across government will place them and government digital public platform they all go get this kind of data where they forget where all man go know well for them they use make I give na the big use once and more as then they remember the World Metrology and Measurement Day. The Salon Standard Builder announced it for May 21 this year. The metric cup them and will make sure say all the one that they do business now markets begin use them Captain Day. And one of Freetown, the notable concert group when a Freetown player don't celebrate them 40 years. Well, family used to me, Catherine O'Connor. I hope you will get a lovely day and we'll continue for the Look SLBC. Tata.
A place cannot produce poems. It can only not prevent them. And Freetown is good at that, for Freetown has its own sudden elegances. People are slow to leave it, quick to return. And there are others who come for a year or two and stay for a lifetime, sensing that they've found a city that is in the world, yet sufficiently on the edge of it to have a different resonance. Let me tell you something about this city. All of us, we're all just passing through, and we've all been here forever. Those who came, those who stayed, those who never returned. Tides turn, seasons change. We've waited and we've watched. But we've always been here. We've always listened, because there is a different resonance here. It comes from the river, and the land, and the sky.
It's our place. All of us.
This city belongs to everyone.
And you know when it's your time.
And it's our time.
Listen, we are Freetown.
We are Freetown!
The golden rules of Freetown.
Don't pretend you're something that you're not.
Don't go thinking you're better than anyone else.
Or that anyone else is better than you.
Don't shout about it. Get on with it.
We are Freetown!
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 Yeah!
We found our voice again.
I'm from India and Freetown.
I'm from China and Freetown.
I'm from the UK and Freetown.
I am from Nigeria and Freetown.
I am from home and Freetown.
This city belongs to everyone.
The fishermen,
the taxi driver,
the barber,
the drummers, the dancers.
All of us.
All of us. Everybody. We are Freetown.
The past is ours.
The future is ours. It's our time again.
And this city belongs to everyone.
The playwright,
the greengrocer,
the teacher,
the dog,
This space is ours.
This light is ours.
The beaches are ours.
The rivers now we own.
The roads are ours.
The bridges now we own.
We are Freetown.
We are all visitors and we've all been here forever.
We've got the mightiest river.
And the biggest sky.
And there's a resonance again.
Freetown. Freetown.
We are proud of this place.
We love this city.
And we want you to love it too.
We are proud of this place.
Na pass we all dey pass like stranger dem, but we all don't dare from ten. Come here, and you'll feel it, that end of the line sense of freedom. Say yes to Freetown. Say yes to freedom.
Love the fish, we get them every day. So Today in Central Africa, it's chaos. Minibuses are on strike, leaving only bush cabs. So, of course, they are in high demand.
Le véhicule de Bangui ne vient pas aujourd'hui. D'habituellement, il y a des véhicules d'ici qui viennent par Bangui pour prendre les gens, mais maintenant, ça arrive, les gens ne viennent pas. Raison pour ça, c'est moi seul qui viens ici, c'est pour cela qu'il y a beaucoup de clients.
Nearly 30 travellers are crammed into just 3 square metres. This car has been transporting passengers for 40 years. This old 504 Peugeot is patched up on all sides. Dangerous, but regardless, she is indispensable.
Ce véhicule-là, on appelle ça baya. Donc il marche bien. Il a fait beaucoup de vitesse. On va arriver vite. Vite et vivant. Et vivant. Voilà.
Alors, si nous avons quelque chose que ça va bien. Il y a une anomalie maintenant aujourd'hui. Un petit truc qui vient de m'embêter.
Public transport is a nightmare for Central Africans. Since 2013, the various civil wars have destabilised a country with an already precarious political situation. Of the 8,000 cabs and 5,000 buses that used to provide transportation in the country, there is almost nothing left. Many vehicles have been stolen or destroyed. So to get around, cattle trucks have taken over. The country's wealth flows into the pockets of armed factions. Without any maintenance, roads disappear, isolating entire cities.
Les médecins ne veulent pas venir travailler ici. Les sages-femmes ne veulent pas venir travailler ici.
The only solution is to transport the sick by motorcycle to the nearby hospital. They have become the ambulances of the Central African Republic. Travelling in the Central African Republic is a struggle on the road as well as on the water. The Ubangui River sees many of these floating coffins, or rather, of these sieves. Shipwrecks are not rare while travelling on these boats. Every day, 6 million Central Africans fight this battle, refusing to give up.
C'est ça que je suis en train de manger. Comme tu vois, même le président de la République mange ça aujourd'hui.
Nola is one of the most isolated cities in the Central African Republic, and getting there or leaving is always a problem. Today, 2 cattle trucks are the only transport available. Dozens of travellers struggle to get a ticket.
C'est comme dans l'avion, quand tu allais monter dans l'avion, on paye son bagage et tu payes d'autres, c'est ça ou c'est pas ça?
But on a plane, you buy your seat, whereas here, everyone shares the space.
Les aliments et les sacs, même les viandes, les brousse et aussi même les chèvres, tout on met dedans. Même aussi le porc, voilà même le porc qu'on met dans les cages là.
There's even a surprising animal.
c'est le pangolin. Je l'ai acheté juste pour s'amuser avec.
It may be cute, but the man quickly forgets that the pangolin is suspected to be the cause of the COVID-19 pandemic. But for now, this shocking animal is nothing compared to the chaos that will ensue. Guillaume, the captain, is overwhelmed by the number of passengers. A good idea that nobody listens to. Everybody wants a place. The truck is taken by storm. There is at least one advantage. Boarding is over in just 5 minutes. Inside the truck, everyone defends their place. Their departure is authorized. Well, one mustn't speak too quickly. Guillaume, the captain, is not easily fooled. Some tricksters took advantage of the rush.
Vous contrôlez quoi là?
Les billets de chaque passager. Oui, il n'a pas son billet. Vous venez de voir, non? Il vient de payer. Maintenant, on va lui faire délivrer son billet.
Qui tu vas?
Mayday Freetown, good afternoon and welcome to the podium. Our quote for today says, nowadays people don't defend what is right, they defend who they like and benefit from. Coming up in this edition of the podium, Ministry of Health and Partners conclude National Health Summit and Performance Awards 2025. APC condemns the printing of fake old membership cards, and as cases increase to over 2,000, government opens Mpox Treatment Center in Freetown. Well, you can be part of the program. Send your messages to 0300737719. The number again is 0300737719. Also, you can leave a comment for us on our Facebook page at slbc.sl. The program is the podium. My name is Stephanie Zayan. Welcome to the podium. The Ministry of Health and Partners have concluded the National Health Summit and Performance Awards 2025 on the theme Improving Health Outcomes for All. Every Sierra Leonean life matters. Participants discussed progress made, how to build on progress made in reproductive, maternal and child health, as well as a thorough review of the current Mpox. But for more on the outcome, I have in the studio the Deputy Chief Medical Officer, Ministry of Health, Dr. Mustafa Kaba. Good afternoon, sir.
Good afternoon, viewers. Thank you for having me here.
And now, the theme surrounded improving health outcomes for all. Every Sierra Leone life matters. Let's talk about the essence of the theme before we come to all of what was discussed.
Well, as a Ministry of Health, our key priority is to ensure that each and every Sierra Leonean has good quality healthcare services. And that involves a lot. It's like creating universal health coverage. The quality and access and barriers that leads to affecting these issues like the quality and access has to be properly discussed and managed well. So these engagements are geared towards regularly realigning ourselves to our focus and our key commitment to providing the services for the people, and looking at the challenges and how do you address them. So the theme was coined definitely to look at that as our primary responsibility to the people of this country, providing adequate healthcare services. You saw we also brought in MPOX. So the theme is also adapted to the prevailing circumstance we have in our country. We have an outbreak of MPOX disease, which is also a key priority of the Ministry of Health to really handle so that it doesn't get out of hand. So it was really brought into these discussions, and it took a centerpiece of our discussions and deliberations. And at the end of the day, we came up with very good recommendations, which we're going to implement.
We'll come to the recommendations. Yeah. And what I want to know is the discussions around improving health outcomes for all. Let's talk about what you plan to do to achieve this.
Well, improving health outcome for all is you look at what are the indicators you use to improve health outcome. For us in the health sector, we are looking at 4 strategic pillars. First of all, the first pillar is how do you really improve the primary healthcare infrastructure, primary healthcare service, because 80% of our population are getting services from these facilities. How do you improve on the quality, make sure they're strong, they have qualified personnel working in those places, they have the requisite drugs. Then you look at the safety net for the primary healthcare facilities, which is the secondary and tertiary institutions, our hospitals in the districts, in the provinces, and also in the western area. We have big public hospitals. How are we managing them? What are the services delivered? How do we improve on making sure that everything is there that's needed to provide services? Not only for what we're doing now, how do you make sure that we curtail on the need for people to go overseas for medical services? When you have both of these, you have to have a strong referral link between the primary structure and the secondary. So this there comes in the referral system, the NEMS, the National Emergency Services, that it's also properly strengthened to bring people from the community to the secondary and to the hospitals. When all of this is worked on, you look at health emergency. Like we are dealing now with MPOX situation. It's a health emergency. It's an outbreak. How are you prepared as a nation to handle these outbreaks? When you have an outbreak like this, there are resources needed, and you don't want also to compromise on normal service delivery for other diseases. People still have pregnancies to handle. We have deliveries. We have children who are sick. We have still infections that are commonly with us. So these are some of the things that this conference looked at in distributing it into different thematic areas like the health workforce, health financing, infrastructure upgrade, equipment support, renewable energy systems for our hospitals and facilities. How do you make sure that the supplies are in there? So you look at electronic and digital systems for supply chain management. You look at gender inclusivity into what we're doing so that we use the gender lens for equitable distribution of health workforce. So how do you make sure that you have qualified, motivated health workforce? How do you make sure that people are trained? You know, not only have the requisite technical skill, but also the mental framework to do the job for which they are assigned to do. But fundamentally, it was a very good meeting with the partners. They involved themselves, and we are really happy at the recommendations which came out of this meeting.
Okay, so now let's come to the recommendations.
Yeah, the recommendations are involved in thematic areas, like I said. One of the key recommendations, which we all aligned and signed on, is that we have to prioritize and tackle this MPOX disease. Of course, it was a priority, but we are reaffirming our commitment again, not only as a ministry, but also with the partners, in ensuring that we tackle this disease. Meaning we have to really strengthen the National Public Health Agency, which is the agency by constitution responsible through the Public Health Act to manage this disease. We as a ministry empower them, work with them. We really give the necessary support that is needed for us to handle this disease together. Another key recommendation was for us to have a sustainable financing model for our health infrastructure, our health institutions. What we are seeing now currently in the country is that if you go to a hospital or any primary healthcare facility, people are asked to pay, right? We don't have a health insurance scheme. We don't have a scheme wherein you go and say, okay, now I'm here, I am sick, please give me emergency treatment and I'll pay later. We don't have that. So there's a lot of delays in accessing our services due to this financial barrier. So how do you have a system in place, a scheme like the health financing scheme, health insurance scheme, that people can go to the health facility with a card and then there's a prepaid something on it, then nobody will ask you for anything, you get your treatment. At the end of the day, money is deducted or the insurance company has to pay. How do we put that into action? Key recommendations were given. Of course, we have to enact it, we have to make sure that we have a system around it, we have to have a governance structure. Hospitals have to be accredited, they have to be equipped, because you have to have the hospitals also ready. If you collect money from people, the hospital should be ready to provide those services. So the recommendations, we are looking at that. So different financial models were brought up as to how do you finance this, because it requires a lot of intensive financial contribution. Another key recommendation was that how do we ensure that our training, our health workforce, the training of health workforce is also empowered locally. We see that a lot of people are traveling overseas when we are going for studies and people don't come back. That has been a big concern. The ministry is losing a lot of brains because the attraction out there is so strong than what we can offer here. But at the moment, it is what it is.
That does not was that not factored in your discussion?
No, that's what
move on.
That's the. I mean, I'm just giving the background to some of the recommendations that came. That I'm just trying to lay the premise.
Better.
People want better, but we also have to be realistic and understand that where we are currently as a country, right? And some form of sacrifice has to come into what we're doing currently to make it move properly. We can never compare ourselves with established countries in terms of better. So we have to have a basis of understanding what prevails. So what are the recommendations? Even though you cannot have it like people there, but make sure that the training system here is properly accredited and organized so people can have confidence in going into it and having a certificate or a degree becoming specialists, which is what we are doing currently. We have to empower that. What you also have to do, when these people are trained, what are the provisions made for them? So staff quarters were recommended, mobility, so I mean to move them to and from work, right? Give them certain risk allowances for them to be in remote areas, because we see the disparity between the urban and rural setting. People don't want to go to rural areas because of some of these challenges, accommodation and mobility. Look at how you have a transparent way of acknowledging hard work as well as promoting people. Like if I am due for promotion, I don't need to see anybody. I can be promoted automatically. There should be a system that picks up me, that recognizes that, oh, yeah, Dr. Kaba is due for the next promotion, without going through any process of talking to somebody somewhere to help me with the process. It should be automatic. So the recommendation is that we strengthen our electronic system of monitoring this, and it should be transparent. That's why we're investing a lot in the IRIS, the Human Resource Data Tool, for it to be launched to ensure that people are given what they deserve. Few other recommendations that came up is how do we, one of the issues we have is electricity, for example, is a big challenge in providing health services. How do we use sustainable energy, right? Moving away from thermal energy generators. So the recommendation is for us to really place a lot of premium on having solar systems, which we have already started, but the recommendation is to do more. If you look at Connaught Hospital now, we've installed a 1 megawatt solar installation at Connaught Hospital, which will take care, at least for essential units. If there's power shortage, they will not resort again to go to generators, which is very expensive to run. Fuel and maintenance those machines will be, and environmentally also they are not friendly. So we are doing primary healthcare infrastructures as well as secondary structures. So how do you have proper governance systems? Because all of this can only work if the governance in those hospitals and those institutions and the district health systems are properly in place. So people should be properly trained. People who are qualified for those jobs should get it. If we need extra assistance, we have to bring on board people. And there are even recommendations to bring in some of the universities some courses that can enhance hospital management, to improve the abilities of hospital secretaries and people working in the district health management team. So it was a very rich recommendation list, which we are going to develop into an aid memoir. When it's finished, it will be officially signed by the minister, and then we'll make it known to the public and circulated.
Now, most of the recommendations you gave, they seem to me as long term. What of the most biting ones? Like someone came from Yenga, from the Human Rights Commission. There are villages which have existed before these people were displaced from Yenga, but there are no medical facilities there. So what of the biting ones, those that could be done now for the people to get access them?
Yes, currently Sierra Leone is one of the most fortunate countries, even without this conference, to say that in terms of the public health, public institutions, we have a high density of public institutions, so that from our assessment, maybe I might be wrong, is that each and every Sierra Leonean has 5-kilometer distance from where they are living to a public health facility. So that is a very good coverage. It's remarkable. We are trying to reduce that by 3 kilometers. Maybe Yenga has some, maybe more than 5, or maybe that's another situation there. We'll have to look at it. But this is what we are trying. So by doing that, we have over 1,600 primary healthcare facilities in this country at different levels, some in the communities, some in the small villages, in big towns, and then in the district headquarter towns, distributed and repurposed in terms of the services they are providing, basic general services. So that one, what we are doing now, 5 kilometers is even what we are reconsidering to reduce to 3 kilometers. So it might involve places like Yenga now, if that's the case, but we are looking at how we can really expand on what we can provide for the populace.
Okay, and so also sometimes, these conferences, they're so well organized, people have ideas, recommendations and all. Let's talk about, now you say you're going to make this into a document signed by the minister and be presented to the responsible authorities. Let's talk about how workable this will be for people to see, because most of what you've outlined, they are so good. I am fascinated by the ideas that came out. So how workable will this document be for people to enjoy most of what you said here?
That was one key thing we admonished us all about, that we are not going to come up with recommendations that are not feasible to apply. We are coming with recommendations that are aligned with our context and aligned with the priorities we have in our country based on the challenges. And secondly, lastly, the available resources. I cannot say I want to make centers of excellence, have high-end equipment in all hospitals in this country when I know I don't have the budget for it. So you can say, okay, I make 2 or 3 for a start. You understand?
And you advocate for more.
And you advocate for more.
That's a priority.
It's a priority, but you can start somewhere,
yes,
which is realistic. You cannot build your house in the clouds. So you have to start with a realistic recommendation. So all those recommendations are realistic enough. And at the end of it, the Herald and all of us were there. The minister and all the partners, we signed openly that we are committed to ensuring that these recommendations are applied to the letter.
And also, another thing, you know, with all of these brilliant ideas and brilliant recommendations, when feasible, let's talk about how the ministry plans to correct the attitude of some health professionals, especially those in government institutions, because most divert patients and other facilities to private institutions for their own benefit, and they just let go the idea of doctors' sacrifice for the oath being taken when you're declared a doctor.
Yes, that's a concern from the public, and we're hearing, we're listening. We are working closely with the Medical and Dental Council that regulates the practices of medical practitioners. But in the meeting, what was key is that how do you have effective monitoring systems in hospitals? Who's accountable to who? And if people are found wanting, what are the penalties that commensurate with what they did? And we should allow this not to be influenced by central systems, and it should be decentralized at the institutional level. People should not come to U building to deal with such matters, but the institutions themselves, they have a strong leadership and governance system that should be able to manage their staff immediately. Otherwise, this is why these things keep coming, because they have to come up to U building, people in U building are maybe busy with other issues.
They impunity because they know better way with it.
And there are strict in the codes of service for civil servants. It's well stated there as to how and people should receive punitive action when they are caught founding. What we've not been doing properly is how do we monitor and enforce that. So the recommendation was to really have a proper monitoring and evaluation system and strong governance, decentralized, to monitor and even to do on-the-spot checks.
Okay.
It's one of the things that came out. If they know I'm coming, everybody will be straight up, right?
Exactly.
But how can we have few people?
And that has worked in the past.
Yes, at night, 8 o'clock, just walk in the ward and see how many nurses are there. Those who are not on nurses, they are queried, or some actions are taken against them. People who, they say people are selling drugs in our hospitals. If I go and catch somebody, you're gone, right? Let us know. And this is where I think we need the public's help. You know, some of these things, people say, okay, these are my doctors, my health workers, I don't want to talk about them. But if you have tangible evidence of something happening, there is a redress mechanism we are putting up together that you can anonymously register your concern and tell us and give us indicators as to where we can go and catch these people. Thank you.
Okay, thank you. We'll come back to that because people may need to know how to access these mechanisms you've put in place, and also we need to talk about the awards because we see prominent health professionals being awarded. I want to know the reason behind that. Continue to stay with us. He is the Deputy Chief Medical Officer in the Ministry of Health, Dr. Mustafa Kaba. While still on health matters, in response to the continuous increasing outbreak of Mpox, the National Public Health Agency has inspected the newly refurbished Mpox Treatment Center at Police Training School, Hastings. Well, for more, I have the Health Education Manager, Ministry of Health, Harold Thomas. Good afternoon.
Good afternoon, thank you.
Let's talk about this facility. What does it look like?
Well, this facility is a very good facility with 400 beds and with proper toilet facilities and all other amenities. And if you go there, you would be getting all that you need, like food, you know, some personal stuff, and even you will get safe transportation to take you to the health facility. And also, when you are sufficiently recovered, you would have also transportation to take you home, and then we would actually advise you on what to do. You know, the cases seems to be a lot on the normal health facilities, and we want to decongest these health facilities. That is why we have thought it fit since Sunday the 18th of this year, in May, we have thought it fit to start this. And the good thing now, we have started getting success story. As early as yesterday, we've gotten some patients actually discharged.
So the facility was opened on the 18th.
Yes.
And now people are being discharged.
Yeah, because
so how long does it take to
well, it
cure
depends. It depends on, and that is why we say early health seeking behavior is okay. And we are moving patients from home care to the health facility at Hastings. So these patients actually will be assessed, and if they are sufficiently recovered, then they will be discharged. And in the coming days and weeks, we expect more of these people to discharge. And the message is that if you have mpox, don't stay at home. Make sure you call 117 or you go to the nearest health facility, and you'll be conveyed to that convenient facility, and then you will actually recover. Because if you look at the cases that we have, very close, in maybe tomorrow or the day after tomorrow, would have gotten like 1,000 people that are fully recovered. We are very close to this. So it means that when you seek you have early health seeking behavior, then you will be all right with mpox.
So that facility is purely for mpox.
Exactly, and that facility is purely for mpox. And the Ministry of Health and Public Health Agency, they are looking at other facilities as well in Wellington, Port Loko, with 100 beds. So we need to concentrate these patients there so that they would not be. We are discouraging home isolation as well, because some of them would not be able to adhere to some of these precautionary measures. So they will be in a place where they will be taken care of.
So, so far, what's the update on curbing mpox spread?
Now as we're saying, all districts across the country have recorded cases of mpox, and then the western area actually is leading, with high number of cases, followed by the western area, rural, and then the Bombali district also is trailing behind this, these two districts. But what we are saying, this actually is a community spread, and we are doing all that we can to go into the community, because the outbreak starts in the community, and we want it to end in the community, and we want to, what we call interrupt the transmission. And there is no way we can interrupt this transmission chain if we do not have cooperation with the public or the community. That is why we are leaning on the community's own support, so that we'll be able to get all of these patients in these treatment centers. And then we are also asking people to adhere to these simple and straightforward preventive measures. As I always say, the instructions for preventing mpox, they are simple and straightforward and easy to carry out. For instance, wash your hands with soap and water, or use alcohol-based hand rub. This one is so simple. And if you see someone with mpox sign, and for the public it's just two signs that we are looking at, fever and rash, you do not need to be a clinician or any medical practitioner before you see someone with rash. And at this stage,
it's just any rash.
Any rash. So the professional would know the difference, and they would know what to do to ensure whether it's to know whether it's mpox or not. So that is just simple. These are simple instructions that we are giving people.
Okay. So now, Mr. Thomas, we want to know, how does the ministry monitor if people are adhering to most of the preventive measures?
Well, now we are also monitoring behavior change. Every day we use social scientific means to make sure that we gauge perceptions of people, we gauge the practices of people, and we also assess knowledge. And then our intervention is based on what results that we have on a daily basis. That is what actually informs our messaging strategy, and even the strategy that we are using. Like now we have decided to move these patients to Hastings, because we have realized that when they are at their homes, some of them do not adhere to these preventive measures. And also and you know the rate at which it multiplies now is like one patient, you know, will actually infect like between 2 to 3 people, and in a week then we'll get maybe triple number of cases. So but if people are cooperative with us for this new strategy, we'll realize that there will be a drop in the number of cases, and then we'll be able to actually interrupt the transmission chain.
Okay, so let's talk about treatment methods, because we know when the cases started, it was a simpler strain, but now you said it was like class B or something. I'm not scientific, but we see the rash is now bigger and more severe than it was at first. So let's talk about the treatment methods, as the ministry devised more ways to treat it efficiently.
Yes, we have specialists in infectious disease control, and these specialists, they know how to treat these particular patients depending on their own presentation. No two patients would have the same type of treatment. It will depend, and some of these patients will have other underlying conditions. So it would all depend on the type of condition. That is why we have people who have the appropriate techniques and skills to deal with these particular patients. So all what the public needs to do is to make sure that they show up in those health facilities, and then the health workers might actually make sure that every patient that goes to that facility is taken care of.
And also, people have this myth that this local gin and all these hard liquors, they help in the cure.
Well, we have tried in a lot of ways to counter this. This is just a myth or misconception. The only way you can actually prevent mpox is by those simple preventive measures, and if you are sick, make sure that you report to the nearest health facility, because these health workers are skilled to do this. And mpox is not like any other disease. Using those alcohol or pegagin or gin or whiskey, as people would say, would not help. It would also help to predispose you to other problems, because if you are taking alcohol and you are sick, you know what that means. So it will also further predispose you to other problems.
Okay, thank you so much. He is the Health Education Manager, Ministry of Health, Harold Thomas. Well, the program is a podium coming to you live on Slbc Television in Freetown. We go for a short break. When we return, we shall be talking about politics. Welcome back. The program you're watching is The Podium, coming to you live on Slbc Television in Freetown. Be reminded that you can be part of the program. Send your messages to 030-073-719, or you leave a comment for us on our Facebook page, slbc.sl. Another issue this afternoon: the All People's Congress Party has in a press release condemned the printing of fake party ID cards, as it will seriously undermine the credibility of the National Executive in its efforts to build the party and uphold its integrity and reputation. According to the release, a member of the party discovered a disturbing incident at a local printing press at Upper Brook Street, where an individual was caught in possession of a freshly printed copy of the party's old membership card. To further discussion, I have in the studio Abdul Karim Korma, member, APC Media Team. Good afternoon, sir. Welcome to the podium.
Yes, I'm not Koroma, I'm
Kamara. I beg your pardon. Sorry. I beg your pardon. And now, welcome to the podium.
It's a pleasure, Cody.
So, with regards to what's happening, let's hear your concerns.
Our concerns are always legit. They are fair. We're just telling those who are attempting to at least see how best they can tamper into the system that the beginning is an act in futility, and those who advise them to refrain from same, that will not lead them anywhere, because they cannot, at least at this point in time, corrupt a system that has been well codified and encrypted. Our database, learning from previous experience, we've taken the lessons learned and made sure that indeed similar will not repeat itself again. We've had the expertise of seasoned tech experts who have coded the entire system and encrypted it to the highest extent that even hackers cannot break into the system. And this morning I said it again, that several attempts have been made, not once, not twice, over 1 million or 12 million attempts have been made to break into our system, to see how best they can hack into the system and pollute our system with different data. But that has not been successful for them at all. So I think they have now resorted to a situation wherein they will print old membership cards and come to the party secretariat again and say, oh yes, we are members of this party from ages, and thus we are now asking that will be issued the new membership card, which now serves for all intents and purposes the only legit card that you will have, that will ensure you to participate into any decision making of the party. So we are now here to make it known to them that even if you have hundreds or thousands of that old membership card, and read my lips, those cards are a non-starter. Whether you've been a former president of the APC, or you've been the former chairman and leader of the party, or you have been the former member of parliament or minister, if you still continue to carry the old membership card, you cannot participate at any decision making in the party, right from the lower level to national level.
So you think
you are only
think that's the reason they are printing this one?
That is the reason.
Just for participating in the lower level election.
Correct. Because don't forget, our March 7 constitution makes it abundantly clear that for you to participate into our decision making process in the party, which is the whole electioneering process, at what level you must have been a card carrying member for 12 calendar months uninterruptedly. That will give you the franchise to vote. And for you to be voted for at the world level, you must have been in the party for 24 calendar months, 2 years. Failing short from that, you cannot participate. You are still a member of the party, but you are not qualified to vote or be voted for. So because I realized, or some have realized, that they are now entrapped by time, so they want to resort to backdating their membership by printing old party cards and backdating them to come and say, you know what, we are now here for verification. And once you're verified, if you've been an existent member in the party for ages, it will show clear. You tick in the box and your details will come up, pop up on the dashboard. It's an IT whole showroom. You come as Abdul Karim Kama, you meet the IT experts, you say I want to verify. They'll ask you for your old membership card and you produce it. And then they'll tick or enter your passcode or your membership details. And then once it is in our database, it will pop up with your face and everything. Hence that is not done, it will show error or not existent. They will tell you this ID card you're having does not reflect the existing data we're having, and thus you have two options. It's either you register as a new member or you don't register. So having done so, the decision is yours. Again, if you are an old member of the party, let's say a member of parliament or cabinet minister or former leader of the party, and you did not verify, you still hold on to the old ID card, and then you want to come and participate in our lower level elections, because all card carrying members who are qualified as per the 12 months requirement at ward level are entitled to vote for their ward leaders. So if you carry the old membership card, irrespective of the fact that you've run for our party as a leader, you cannot still participate because you've not verified and regularized your current status. Because we've made it abundantly clear that all old membership cards are non-status. We are not recognizing them anymore, and they are of no essence or relevance in our party. That is why we are asking our membership right across the nation and in the diaspora as well, that it behoves you now to come and verify, regularize your status in the party, so that we will know whether you're somebody who is owing the party. Because it's only when you regularize your status with the party, then we will know whether Abdul Karim Kamara has been in this party for ages and he has only been paying his dues for only 12 months or 1 month or 2 months. Because don't forget, dues are paid monthly. You may have bought your membership card and may have only paid for 2 months. So there are still remaining 10 months you've not paid for. But when you come and regularize your status, we'll tell you, we'll not issue you the new membership card anymore until you have fulfilled your backlog. Okay. Failing to do so, we cannot give you a new membership. So all those who may have not fulfilled all these requirements are disenfranchised from voting.
So have you investigated to know who are behind this, the members who are behind this?
Yes, as it is now, we were at Upper Brook Street at that local printing press, and those that were involved have been invited by the Criminal Investigation Department for thorough investigation. That is more so the reason why tomorrow 12 o'clock the party will be having a press conference on the same subject matter, to at least make it known to our membership across the world that indeed this is the finding from the Criminal Investigation Department. These are A, B, C, and D. These have been investigated, and there are some evidence pointing at them that indeed they had a role playing in this particular act. And once that is done, they will get back to the people and tell them that Mr. A, Mr. B, Mr. C is involved. But however, as from the press release issued by Comrade Lansanadum, we are not pointing fingers at anybody at the moment. We are just asking the Criminal Investigation Department to investigate the issue to the latter, and then let them give us objective investigation, and then we'll take internal party redress mechanisms. If the need arises, we'll resort to national redress mechanisms.
So what will happen after to these people who are found guilty?
That is
because yesterday is just an incident. You don't know what has been happening.
As it is now, we've got reported incidents at Waterloo. The chairman in Waterloo, the Western Rural Chairman Kasho, has apprehended a whole chunk of orders that are printing the old membership cards at different printing press. Another report has reached our secretariat again that similar thing is happening at 91. So it's all over the place. But we're just telling them that this is an act in futility. Because even if you hold the old membership card, it will not give you the leverage to participate, except you have verified that old membership card. So it's an act in futility. So that's exactly what we're telling them. So we are not apprehensive of those guys who will bunch up or come in the polling day, because our lower level begins in August, who will come in their thousands or in their hundreds to come and vote, and they will tell you, hey young man, you do have a membership card which carries the All People's Congress. But the unfortunate side is, this is the old membership card which is of no relevance. We only allow people with the new membership card and that one that is updated. You can still have the new membership card, but if your date of registration in the party is still less than 12 calendar months, you can still not vote, because your name will not be on the voters list. We are applying the constitution strictly sense.
Okay, now Mr. Kama, we know that you were on a tour of the whole country, even the diaspora, telling people, telling them about the criteria and all of what you're doing internally to restructure membership in your party. Do you think that the membership did not understand, or they are just unscrupulous?
Well, it was as a result of the fact that majority of them, I'm speaking from my own personal perspective, it's not from a party position. But you know, after the June 23 2023 election, the most butched election ever in the history of this country, there were two things that came on board. The issue of the APC fighting the electoral justice saga, and the APC again tried to run its internal party operations. So you remember you hosted me on again on that same topic on different time. That the APC now, some members are saying, you know what, we are not going to embark on anything pertaining to the party. Our whole efforts and energy are going to be geared towards fighting for electoral justice. And then the leadership of the party came. He says, you know what, in as much as we are fighting for electoral justice, let us equally do it simultaneously with the internal party administration and others reneged. But they forgot that majority of them are not registered with the party, and that majority of them still require verification and updates of their membership status. So because they are fall short of that, I am of the opinion that they are now resorted to shenanigan acts to involving or indulging themselves into criminal syndicates or cartels as to printing fake ID cards to just come and disrupt the entire process. But the answer to that is that it's an act again in futility. It's not going to yield any positive result because the whole system has serious gatekeepers. All gatekeepers are intact and ready to check everybody that enters into this
now
room.
So let's talk about this new system. How secure is it?
Honestly, I will tell you that it is maximum, it is Tech Pro, and it is Pro Max. That to the extent that our expertise, we're starting to sell our expertise to even the banking community. People are beginning to ask us, how do we go about it? They want to have a similar system. We've started sharing some professional expertise to some banks. I don't want to name them for security and other reasons, but we are helping them in their tech as to how they can upgrade their Visa cards, their smart cards, and so forth and so on. But I will tell you sincerely speaking that our tech, as far as the cards are concerned, is top notch.
Okay, so now let's come to the issue of compromise, because sometimes when a leadership has favorites, they would want to compromise regardless of all the criteria you've mentioned here. Let's talk about when the time comes, you would stick to all these regulations we've put in place.
That is more so the reason why, if you notice, when it was time for Dr. Samuel Martin Wilson Kamara to vacate the office after 6 months, having failed to secure State House, we came and asked him, my brother, with all due respect to you, 6 months has elapsed. You're no longer the leader of the party. That tells you at this moment in the APC, it's no business as usual. We'll create a level playing field for all, and there's no big names in the APC anymore. We'll create that platform wherein everybody feels equal and everybody has an equal opportunity.
Alright, well, thank you so much. Continue to stay with us as I go over again to the Deputy Chief Medical Officer in the Ministry of Health, Dr. Mustafa Kaba. Now, Doctor, the awards, let's talk about the individuals that were recognized.
Well, as a ministry, one of the things we are really trying to do is to really acknowledge hard work and motivate people to do more, and also use this also to inspire those ones who have not been working hard to look forward to doing something. And if you know that there is a way of me being recognized for my hard work, people really step up. So the ministry, through this meeting, had a committee that looked at key performance indicators of health institutions like waste management, how many people are admitted, your workforce, and the mortality, people dying in your hospital, cleanliness, all those kinds of things. We look at your administration, how structured is it to provide services, your financial management. So points were allocated. So facilities, you had different categories. You had facilities, hospital, best hospital in the district, best tertiary hospital, best hospital with the best cleaning activities, best primary healthcare institution, different categories, and even we awarded prizes to civil society groups.
Because
that have been working.
That's my question, because
That
most
have
of
been
them
working
have
closely.
been calling the ministry out, but yet still you manage to recognize them because you acknowledge the work they have been doing, because they have been keeping you on the toes. Especially Health Alert. We had one of them this morning, and because we want to know if it's not a compromise between the Ministry of Health and them, not to bring out issues they have been bringing out.
No, I mean, we are not looking at it, but I think there should be ways to say thank you to people. I mean, we don't want any form of compromise. We don't want to do their work. For us, it's even good to have the civil society to keep us on our toes. We are not going to judge our work for ourselves. We need people to do that independently, and their work is very important in keeping us on track and giving us the relevant feedback. So if we compromise that, it's even affecting our service delivery. But at some point in time, people have to be recognized. And it was done in a transparent manner, and people received awards, both public hospitals, individuals, private institutions, and the partners who have been supporting the ministry in the drive in reducing maternal mortality. I will tell you now, we have very good indicators in terms of pregnant women going to deliver in our hospitals. The rate of deaths have really reduced drastically. Even the child death is also being improved drastically. But we are not doing it alone. We are doing it with partners who come in with technical support, financial, as well as also equipment support. So we have to thank people. So this is something now we hope to be doing regularly, so that at least the health workforce and people working on improving our indices in the health sector are recognized in a very special way.
Okay, so was Mr. Thomas awarded?
Well, he's
because now you see, regardless of the fact that he is a staff in the Ministry of Health, now some people would misunderstand him for a doctor, because now the terms, the way in which he addresses issues, the way he answers questions, you know, is remarkable in what he does.
I mean, not everybody will be awarded. I mean, award comes in different forms. We recognize his hard work. And some of us at the leadership level, we don't give ourselves award, but it's good for you to step out of this particular situation. Don't look at yourself, look at those people who are at the implementing end of what we are putting together. They should be awarded before thinking about us who are leading the process.
Okay, so finally, as I close with you, now I'm interested in the financing, because you mentioned that you will work with what you have. It's good to be satisfied with what you have, but because of the demand is more than what you have. Let's talk about modalities you put in place to ask for more from the government or partners who are interested in investing in healthcare in Sierra Leone.
Yes, we always go back to government because it's the main body responsible for funding public sector health service delivery. We are advocating for an increase in budgetary allocations and timely delivery on that, because we thought that services are really delayed, and hospital systems, clinics are very expensive to run. Even if you open a private hospital, you know how much it costs to buy drugs, how much it costs to clean, how much it costs to pay the staff, energy supply, water supply. All of that has to be funded by somebody, and we have a system in place which looks at free healthcare. Somebody has to pay for it. Somebody is coming free, receiving services free. A pregnant woman going through cesarean section, admission not paying. Who's paying for that? Somebody has to pay, otherwise those services will stop being provided. So the government has been contributing a lot, but there's still a gap which we are presenting to the partners. That's why one of the things we are looking at is what I mentioned earlier. You have to have a sustainable financial model through a health insurance scheme, where all of us Sierra Leoneans can be chipping in every month from our small salaries. If you are not working, the rates are low. Those who are working have a little bit of higher, but it will not affect, you know, what you take home. Really, it's just a small thing. But if all of that adds up, plus some taxes on tobacco or alcohol or road traffic, road taxes, we put everything together and ask for some donor support, we'll be able to start up our own health insurance scheme that will be able to provide the necessary resources without resorting to government resources all the time, which is also sometimes a big challenge.
I said one last one, but another one, the maintenance for especially government hospitals in the country, because they will have this equipment and sometimes it will be working and then they work this, that, and all of this. Let's talk about that.
It's good that you brought that up, and it's one of the things we discussed. And for us, we've already made gains in the ministry. This year, we've launched the first ever biomedical engineering unit within the Ministry of Health. It did not exist. So what used to happen was that people were bringing their own people to repair the equipment, and sometimes we have different equipments without proper specifications aligned to our health, our conditions, our environment, and they break up, and there are no people, nobody to repair it. So now we have this unit. We have a consultant, a Sierra Leonean called Dr. Williams, Dr. Dinzy Williams, a highly technical biomedical engineer, a female. She's very good, and she has a team now of technicians who she's building up to support her, so that each district will have one biomedical engineer coordinator, and under that district coordinator, he will have now technicians in the facility. So this is the network of structures we have put in place. Their role and responsibility starts from the procurement process, right? They will be involved in procuring the equipment. So they know the specifications, they know which ones we need in this country, which one are easily to replace. And so where can you get easy spare parts? How can we go for better contracts? How can we negotiate with the people developing this equipment without having second man in the middle to make to reduce the quality of what we have? So they are going to be involved in the procurement, the delivery, installation, training of the people who are going to use these equipments, and the sustainability plan has to also be done with them. So currently, one example I will bring is we are bringing in CT scans for the first time in public hospitals. We had one old one sometime, but this one now is going to be a very high-end equipment, the 128 slice CT scan for Connaught, and one will be posted in the provinces. So we are decentralized. These are high-end equipments. We don't have the people to manage it here. So the technology has to be thought through. We have to train people. So the biomedical engineer and team are really involved in the process to ensure that we land it, install it, and have a sustainability plan around it. And whilst we are doing it, people are going to be trained to also develop that capacity to handling these sophisticated devices.
Okay, so will this cut cost, because we know what obtains when they are not available in government institutions? We go to private, and that's killing people.
Yeah, sure. It will cost. Look at what we do with dialysis. There was a time we did not have any dialysis in this country, but due to the fact that the past 2 to 3 years we have a dialysis running at Connaught, with 5 beds, the cost of dialysis at Connaught is $30, in the private hospitals is $100. So it's really done at a subsidized cost. Some money has to come in. You cannot do it completely free.
That's true.
But the cost in our public facilities is really reduced just to provide some cost recovery so that the machines can keep running. It's the same approach we're going to use to all other equipment and devices we are installing in public hospitals.
Okay, thank you so much, Dr. Kaba, Dr. Mustafa Kaba, Deputy Chief Medical Officer in the Ministry of Health, and finally, Mr. Harold Thomas. Just take us through briefly the process for accessing the hospital. What you need to do before you can be admitted or hospitalized if you have mpox.
Yeah, you just need to, if you or anyone you know have these symptoms, make sure you just call 117, which is a toll-free line, or you go to the nearest health facility. They will find a convenient place for you to stay until our safe transportation comes in and pick you up to a new facility.
Thank you so much. Well, finally, Mr. Abdulkarim Kama, as we end the program, we know tomorrow you are going to have a press conference to brief people on what you plan to do about these people. So just round up and tell us what more to expect about this very professional way you are handling the party right now.
I want to allay the fears of all and sundry that, again, our system is highly protected, it's highly security conscious, it's top-notch technology, and that everything is nice So these distractions has no room in the current dispensation, and they cannot in any way hinder our process. Everything is set to kickstart exactly in August, and we'll get a very successful OLF election.
Okay, thank you so much. Well, that's how we end the podium for this afternoon. Many thanks to my studio guests for being part of the show. The Deputy Chief Medical Officer in the Ministry of Health, Dr. Mustafa Kaba, the Health Education Manager, Ministry of Health again, Mr. Harold Thomas, and APC Media Team Member, Abdul Karim Kamara Esquire. The program was produced by Joseph Stanley. Before I go, the quote for today says, nowadays, people don't defend what is right. They defend who they like and benefit from. My name is Daphne Zainab Kamara. The podium returns tomorrow, same time. Have a blessed day. Goodbye.
Thank you.
Thank you.
Thank you.
Hello and welcome to News Brief from the Hour with me, Cynthia Kaman. The Sierra Leone Standards Bureau has joined the global community in commemorating World Metrology or Measurement Day on the theme Measurement for All Times for All People. This year's celebration marks 150 years since the signing of the Metric Convention in Paris. The treaty laid the foundation for international cooperation in measurement standards. The biggest highlight of the commemoration ceremony of the World Metrology Day was the announcement that effective May 21st, 2025, metric cups will be enforced in all markets across the country. The move is aimed at promoting fairness and transparency in trade and consumer transaction. Executive Director of the Sierra Leone Standards Bureau, Dr. John Paul Kaisamba, said the measurement was the bedrock for fairness and quality in every society. Deputy Minister of Trade and Industry, Fatmata Kamar, commended the strides made by the Standards Bureau and reaffirmed government's commitment to modernizing its institutions. The Freetown Players, one of Freetown's most outstanding theatre group, has celebrated 40 years. The celebration held at the National Peace Museum brought together artists, journalists, and cultural fans to reflect on 4 decades of impactful performances and social advocacy. According to the founder of Freetown Players, Charlie Hafner, their globe was not only to celebrate the past. Their goal was not just to celebrate their past, but also to inspire the youth to come on board in promoting the cultural expression and social change. He said they wanted them to understand the power of performing art in addressing social issues and fostering unity within their communities. The event featured series of local songs and performance that highlighted the group's journey. The audience was treated to a lively display of talent in bridging the gap between generations. The group rose to fame in 1980s, entertaining audiences, and succeeded in expanding the role of theatre from just entertainment to an effective tool for information and education. Parliament has unanimously approved Justice Fatmata Bintu Al-Hadi following her appointment to the Supreme Court of Sierra Leone. The former appeals court judge has over 2 decades of legal standing, and she is the only female judge currently sitting in the Supreme Court. Presenting the nominee of approval, the leader of government business, who doubles as the chairman of the Committee on Appointment, Honorable Matthew Numa, said the nominee had a proven track record and a prestigious career in the legal and corporate sector, which has made many to describe her appointment as a deep commitment to justice delivery with integrity. In the debates leading up to her approval, legislators across the political divide showered praises on the nominee with admiration for a solid blueprint in the legal and corporate sector. Justice Fatmata Bintu Al-Hadi is also a lecturer at the Sierra Leone Law School. She has climbed through the ranks in the justice system from the High Court, Court of Appeal, and now the Supreme Court. The Permanent Secretary of the Ministry of Communication, Innovation and Technology has described the computer system framework for public digital services as key in shaping effective government strategies. Stevenson Commander was speaking at the New Brookfields Hotel during the occasion of Validates the Document. Speaking on the theme Unified System for Efficient Public Service, Stevenson said that the country will leverage on modern technology to attain the level of digital upgrading it desires. During the group deliberation, other speakers, including the consultant, said the framework will enhance transparency, reduce corruption, and offer a blueprint to build a unified data and public service. Some of the recommendations in the findings presented for final validation included to put into regulations on national data governance, like data sharing on computer systems across government agencies and government digital public platforms. Well, that's it for News Brief on the Hour with me, Cynthia Kamara. Continue to stay tuned to your state broadcasting. Bye-bye.
Discover Sierra Leone, a hidden gem of West Africa, where the rhythms of life dance in harmony with the beauty of nature.
feel the heartbeat of our culture in every beat of the drum, in every step of the dance.
Experience the tranquility of our shores, where each sunrise brings new stories and endless possibilities.
Immerse yourself in the vibrant tapestry of our daily life, where every color tells a tale and every face a friend.
Come, be enchanted by the sights and sounds of Sierra Leone.
A place where your adventure awaits.
And memories are made.
In this way. So not specifically on the map, not that I've seen, but I do understand from Israeli officials that the sort of the goal here is to actually push the Palestinian population to the south of the Strip, where Israel is now establishing this new sort of zone where aid will be distributed by a private security company.
Is this, Emmanuel, is this Al-Mawasi, just to be clear, that we're talking about?
No, not the Al-Mawasi, but actually in the Rafah area. So right in the farthest point south in the Gaza Strip. There's efforts right now to build this whole logistical infrastructure there to carry out this new aid distribution method, which still hasn't begun yet. The aid trucks that entered Gaza in the past 2 days are entering through the sort of the old mechanism where the UN takes the trucks in, they're brought to distribution centers all in Gaza. Israel's working on setting up a new method only in the Rafah area to try and bring all the civilians down there.
The Palestinian Authority says Israeli soldiers have fired on a diplomatic delegation in the occupied West Bank. No injuries were reported in the incident, which happened in the flashpoint city of Jenin. The Israeli military said shots were fired into the air after the delegation, which included diplomats from Spain and Canada, strayed from a previously agreed route. It said the soldiers who fired the warning shots had not realized that they were diplomats. The Israeli army said it regretted the inconvenience. More on the Middle East throughout the day, but here the Prime Minister has announced a major U-turn on the decision to limit winter fuel payments for pensioners, saying he'll make more older people eligible. More than 9 million pensioners lost out on the payment last year, and an announcement on who will now qualify is expected in the coming months. But this represents a high-profile reversal for the government, who had repeatedly defended the policy, as Ben Wright now reports.
Are you going to reverse welfare cuts, Prime Minister? What about winter fuel allowance cuts?
It's a question many Labour MPs have been asking too, as demands grow for a rethink on welfare policy. Both the plan to cut £5 billion from the benefits bill and the decision to means test winter fuel payments.
We come to Prime Minister's questions.
And in the Commons this lunchtime, the Prime Minister revealed a big about turn.
We want to ensure that as we go forward, more pensioners are eligible for winter fuel payments. As you would expect, Mr. Speaker, we will only make decisions we can afford. That is why we will look at that as part of a fiscal event.
When this inevitable U-turn on winter fuel comes, and it will, from a desperate Prime Minister, what will he say to the 348 MPs who went over the top and voted for the winter fuel cut last September? Just like the British public, how can any of them ever trust him again?
No more deaths from benefit cuts!
This move on winter fuel payments will embolden Labour MPs urging the government to reconsider its plans to impose stricter tests for those claiming disability benefits.
We really need to pause the welfare cuts. We need to make sure that MPs are not voting to make people poorer before they have all the information before them. So this idea that we should just keep pressing ahead would be absolutely wrong.
But this morning, the Work and Pension Secretary gave no hint of a broader change of course.
Welfare reform is never easy, and it is rarely popular, perhaps especially for Labour governments. But no responsible Labour government can resile from taking decisions because they are too difficult, because this is not good enough for the people we came into politics to serve.
But the losses Labour suffered in this month's local elections and its drubbing in a by-election have deepened the concern among Labour MPs that the party is already paying a political price for its policies. And running through this row about welfare is a bigger argument within government about its broader tax and spending plans. The Daily Telegraph has seen a memo from the Deputy Prime Minister Angela Rayner to the Chancellor, written before the March-spring statement, proposing 8 potential tax increases. Rachel Reeves didn't implement any of them. But the timing of this leaked memo says a lot. 3 weeks before the Chancellor reveals her spending plans for the next 3 years. And with some government departments facing real terms cuts, ministers are wrestling with a Chancellor who seems determined to keep a very tight grip on the public purse. But we know now the government will do something to soften the impact of the winter fuel cut, one of its first acts in office and a decision strongly defended by ministers in the months since. One question now is whether a further welfare retreat could be coming as pressure from Labour MPs builds. Ben Wright, BBC News, Westminster.
Let's take it to Westminster. We can join our political correspondent there, Jack Fenwick. Jack, still lots of questions that people will want answers to. Take us through them, particularly, and starting with, do we know who's going to qualify?
Lots of questions, as you say, and a lot of the details around this U-turn are still up in the air. Now, there may have been some hints in the Prime Minister's language that we could see a change to the threshold at which pensioners are eligible for these payments, but it's not impossible that we see a complete reversal of the policy altogether. On timing, he mentioned a fiscal event. Now, as we understand it, the official announcement of this is set to come in the budget in the autumn. But again, there's a lot can happen between now and then, so it's not entirely clear when, in practice, these payments will start again for pensioners that will become eligible who are not currently. But I think regardless of how those details end up going, this is a significant move politically by the Prime Minister. As Ben said in his report there, the move to cut winter fuel payments for millions of pensioners was one of the very first things that Keir Starmer's Labour government did when they were elected last July. Now, we've had months now of hearing that large parts of the public are pretty angry about this policy, and yet week after week we've had Cabinet Ministers and Labour MPs going on the airwaves to robustly defend this and defend the principle of why they felt they needed to do those cuts. Well, now they may be wondering, you know, we went out to bat for this policy and now it's going to be changed. That is no doubt something that will be going through the Prime Minister's mind. And as well as his own backbenchers who have been uneasy about this but are also uneasy about other welfare cuts as well, as Ben was talking about in his report there, I think the other group of people that the Prime Minister will be keeping a close eye on in terms of their reaction to this is the general public. He will be hoping that the public see this as evidence of a government that is not only willing to listen to concerns, but willing to change its mind on significant policy decisions too.
Jack, thank you. Stay with us around the world and across the UK. This is BBC News.
This is frontier country.
Broaden your horizons.
If this is what being a 21st century nomad is all about, sign me up.
The Caribbean's relationship with the seas are changing. And deepen your understanding.
What must it have been like for them, not knowing whether they were going to make it?
How important is this region?
If something starts changing here, we see the change all over the world.
This is just incredible. The Travel Show on BBC News.
Disinformation.
There is no climate change.
You think you're winning.
Erosion of trust.
Fooling people in the most sophisticated ways. But it's because of you we get up in the morning and work through the night 24/7. So no matter how hard it gets, we'll always pursue the truth. The fight for truth is on.
Welcome back. The Sudanese military says it secured all of Khartoum state nearly 2 months after recapturing the capital from its rival, the paramilitary Rapid Support Forces. This would mean the army controls central Sudan, and that shifts the focus of the war to the country's western regions. 2 years ago, Sudan was thrown into disarray when its army and the paramilitary RSF began a vicious struggle for power. The war has so far claimed more than 150,000 lives, and in what the United Nations has called the world's largest humanitarian crisis, about 12 million people have been forced to leave their homes. Our correspondent in Nairobi, Barbara Pletasher, explained what this means now for the conflict.
Well, you know, Lucy, the big breakthrough for the army came in March when they captured Khartoum City, which gave them control of most of the capital region. But the RSF had 2 holdout positions in the city of Omdurman, which is just across the Nile from Khartoum. And the army says it's now pushed them out of that. And so it is basically controls all of Khartoum state and controls all of central Sudan, which is the end of an offensive that essentially began last September. And what this does now is truly shift the focus of the war to the western region of Darfur, which is the RSF stronghold, and also to the southern Kordofan region, where there's been quite a lot of intense fighting in recent days. And it has to be said that although the RSF has been losing ground, has been losing territory, in recent months it has also started to launch more and more long-range drone strikes quite deeply into army-held territory, hitting civilian infrastructure like power stations, affecting water supplies, and so on, and even hitting the army-controlled area of Port Sudan, which is essentially the wartime capital. So it can still have an impact, even though it doesn't control territory close to where the army is based. But I think the active front line now is shifting further south, especially in the Kordofan area, which I mentioned, Lucy, because if the army is able to take back territory there, then it could get a strategic route into Darfur, and especially towards the city of Al-Fasher, which has been under siege for more than a year and where the fighting is most intense in Darfur.
In terms of Khartoum state, though, Barbara, does that mean there's enough security now that people can actually return and start thinking about resuming their lives? How does it feel to be there?
Well, I mean, yes and no. I think it's not an active combat zone anymore, but there's been a huge amount of damage in Khartoum. There's a lot of unexploded ordnance around. There's a lot of buildings that have been destroyed. The services are still not completely up and running. So you've had some people returning, but not as many as you might have expected. And it remains to be seen to what degree the authorities are able to restore services and clean up and rebuild. I know there have been some private initiatives, but in terms of the official ones, it's not entirely clear. Also, as I mentioned, the RSF has been able to make these long-range strikes, and just earlier this week, or maybe late last week, can't quite remember, 3 power stations were hit in Omdurman, the city across the Nile from Khartoum, and that basically plunged the capital region and large parts of the state into darkness. And so that has affected, again, the ability to rebuild and to return. It has also affected the humanitarian situation, which is dire, as you said, because this means when power goes off, of course, water is affected, hospitals are affected, and that makes it that much more difficult to deal with people many of whom still displaced people in that area.
Let's turn to South Africa now, and in a few hours' time, the country's president, Cyril Ramaphosa, will meet President Trump at the White House. He is there as South Africa is currently locked in a diplomatic dispute with the US after Donald Trump claimed the country's white minority were facing genocide and racial segregation. These claims denied vehemently by South Africa. Under a special refuge program, the US welcomed 59 white Afrikaners last week. The 2 presidents will talk about trade as well, with Cyril Ramaphosa hoping to ease tensions. Our correspondent in Johannesburg, Pumza Falani, takes us through what's at stake.
Cyril Ramaphosa is no stranger to tough negotiations. He was sitting with Nelson Mandela in a room with white men who once led this country and led the country's racially oppressive apartheid system. Along with Nelson Mandela, he helped to negotiate a peaceful agreement and steer the country towards democracy. This time around, he finds himself in another room with tough negotiations expected, in a meeting with the US's Donald Trump. But let's get one thing clear. Mr. Ramaphosa has said he is no amateur to the game, that he brings some skills that could help equalize things in the Oval Office. He's hoping to not only broker a trade deal between the US and South Africa, one that could benefit both countries, but he's also hoping to try and thaw recently frosted relations between the two nations. Mr. Trump has made no secret of his displeasure around South Africa's stance on Palestine. He's also repeatedly dug deep on claims that white South Africans are under a genocide in South Africa, claims that land is being seized with no compensation, something that Pretoria has repeatedly denied. So make no mistake, this meeting has tension baked in. But Mr. Ramaphosa is hoping to use something else to his advantage at this gathering. He is the current chair of the G20. Countries in the G20, some of whom have complained at repeatedly being targeted by Mr. Trump and his threats of hefty fines, will also be looking at this meeting as perhaps a steer on how to navigate relations between a president who is not known for his subtle diplomacy, let alone a president that is easily moved from his own view to that of the consensus. Pumza Fihlani, BBC News, Johannesburg.
Spanish police are investigating the shooting of a former senior Ukrainian politician in Madrid. The victim who died at the scene is said to be Andrei Portnov. He was dropping off his daughters to school when men on motorcycles opened fire. Let's take you to our correspondent in Madrid, Guy Hedgecoe. Guy, what else are police saying? What happened?
Well, at the moment, the investigation seems to be pretty wide open. They have not detained any of the individuals who are believed to have carried out this assassination. We're told that 2 or 3 individuals shot at Mr. Portnov just after he dropped his children off at school. And just moments after he was shot, the emergency services were called, and by the time they arrived at the scene, he was dead. There is obviously a tremendous amount of baggage behind Mr. Portnov. You know, he was formerly an advisor to Viktor Yanukovych, the Ukrainian president who was ousted in 2014. And he has faced charges in the past of corruption and treason within Ukraine. He's also faced international sanctions. So I think the police will be looking at all of those issues and all of that detail as they investigate this case.
Have there been any other high-profile crimes involving Ukrainians and Russians in Madrid, Guy?
Yes, I mean, this is not totally unprecedented in the sense that, for example, a couple of years ago, there was the case of a Russian pilot who had defected to Ukraine and who then went to live on the coast of Spain, supposedly in hiding. He was found dead just a couple of years ago. So this kind of situation is not totally unprecedented in Spain.
Guy, thanks so much for the update. Guy Hedgecoe there in Madrid. Do stay with us. The business is coming up and we'll have more for you from the Middle East later in the programme as well. We'll be live in Bilbao, counting down to Tottenham versus Man United.
Hello. We've seen some heavy rain across parts of Central Europe over recent days, especially in France. In the Tarn and Var regions, there's been some major flooding. The system that brought all that wet weather across France is just easing its way gradually further eastwards, so particularly heavy rain in store for parts of Switzerland, northern Italy, some heavy snow for the Alpine region, that heading across parts of the Balkans, right stretching up towards Poland into Finland as well. Meanwhile, things are going to be warming up across Turkey over the next day or so before some showers arrive later in the weekend. Could be another low pressure developing in the central Mediterranean into the weekend. Some showers through central parts of Spain, but mostly dry for the likes of Lisbon in Portugal, 24 degrees there in Madrid. Slightly cooler conditions across the UK than we've seen of late. Cooler, windier and wetter for much of Scandinavia. Some snow over the mountains of Sweden and Norway too. Heading into Friday, as that low pressure continues its progress eastwards, again some fairly heavy rain and brisk winds for parts of Finland, stretching through Poland, down into central Ukraine as well. Could be some heavy showers there. So generally things looking much more unsettled compared to of late across northern and western parts of Europe. You can see that with the outlook for London. More showery rain to come here. A few showers for Paris too. Madrid should stay dry with some sunshine. Plenty of sunshine to come for Athens too, but a cooler, showery spell of weather for Kiev. Bye-bye.
Britain is under attack every day. It's become a national crisis.
The disruption was massive, devastating.
The enemy is hidden.
We are everywhere and nowhere.
Cybercriminals are hacking in to our local authorities.
One of the worst hit, a small council overseeing the community of Redcar and East Cleveland.
And you actually feel quite helpless.
Redcar and Cleveland council services were affected for months.
Yes, the councils, the big businesses, they should be prepared for things like this. They're not the ones that's actually being targeted, it's the little people.
With many other public services in England coming under attack, we track down one of the Russian hacking gangs. And we investigate whether more of the UK's vital infrastructure could be at risk of a catastrophic cyber siege.
When the weather can't make up its mind, we can help you make up yours. Check on BBC Weather.
In a world where media is evolving faster than ever before,
where stories are shared in bite-sized portions,
influencers change minds,
and news arrives in an instant.
We hear from media insiders on their perspective on the world.
And uncover the stories behind the latest trends. Join us for The Media Show on BBC News.
Now on BBC News, the latest from New York and around the world. Business Today.
Live from London, this is BBC News. People in Gaza are still waiting for food and medical aid 2 days after Israel slightly eased the 11-week blockade on the territory. These are celebrations in Sudan as the army says it's driven paramilitary forces out of the whole of Khartoum state, marking a significant shift in the civil war. A web of intrigue surrounds the recent spate of cyber attacks on British retailers. We investigate the so-called Scattered Spider Collective. And Man U and Spurs prepare for the final of the Europa League. We'll bring you an update from Bilbao. I'm Lucy Hockings. Welcome to BBC News Now. Before we bring you the day's news, let's update you on what is happening in the world of business. Wall Street opening lower today following a string of earnings from large US retailers, showing a mixed picture on the state of US consumer confidence. Target cut its annual sales forecast after posting a sharp fall in quarterly same-store sales, attributed to the decline this uncertainty being caused by Donald Trump's tariff war. Meanwhile, it was a slightly better picture for home improvement retailer Lowe's, which posted a smaller than expected drop in sales thanks to what it described as strategic investments in its stores and technology. And discount retailer TJX beat sales estimates as shoppers look for details and deals to save money in the face of growing economic uncertainties. Let's speak now to Will Rind, who is founder and CEO of Granite Shares, joining us live. Will, good to see you. What do you see in the new retail earnings out this morning?
I think it's probably not too bad. Some of the expectations perhaps were a bit lower than the results that we've just seen. So results better than expected from some of the major retailers here. And that follows on from companies like Walmart, which I think posted, better results than perhaps people thought. But the key question here is just the sentiment and the health of the consumer. Because as of right now, the market has performed well. We've rallied well off of the lows from April. But the big thing in the retail sector is the confidence and whether the consumer can maintain the health going into the end of the year.
On the wider market, though, Will, do you think the Moody's credit downgrade and that jolt in Treasury yields are enough to pour a bit of cold water on the recovery in stocks that we've been seeing?
A little bit. It's certainly having an effect, although I would say that it's much milder. The big effect from the downgrade happened, in my mind, back in 2011 when the USA lost its AAA rating. And this time around, it's more reflected in what we've seen in the fixed income markets, and bond prices have been pricing in this move. So a little bit, but not too much.
Well, good to get your thoughts. Thank you. In a couple of hours' time, as we've been talking about all day on News Now, President Trump will be hosting the South African President Cyril Ramaphosa at the White House. This comes with relations between the world's biggest economy and Africa's biggest economy really under strain. Now, if the two sides can't agree to a trade deal, 30% tariffs on everything South Africa sells to America are due to come into force in July. Trade between the two was worth just over $20 billion last year, but South Africa is far more dependent on the relationship. Three-quarters of that trade was South African exports to the US, including metals, vehicles and fruit and vegetables. And US aid to South Africa, worth $330 million last year, mostly spent on healthcare, has been blocked by President Trump. He's unhappy with a range of South African policies, including the treatment of white farmers. Well, Alan Mokoki is the CEO of the South African Chamber of Commerce and Industry, which describes itself as the voice of South African business and has about 20,000 members. Good to have you with us, Alan. Pretty high stakes today, then, for this meeting between Mr. Ramaphosa and Mr. Trump.
Good afternoon to you and your watchers and listeners as well. No, absolutely. It's a very important meeting from a South African point of view because we do value the relationship with the United States of America.
The US, as we know and have just been pointing out to our viewers, is South Africa's second biggest trading partner. Increased tariffs then are really going to bite. How much pressure is there to negotiate now this lower tariff rate?
Well, there's no a doubt about the fact that we do want to go back to what we had before, because we did have AGOA, the Africa Growth Opportunities Act, that allowed quite a huge number of South African products and other African markets to go into the United States duty-free. So losing that is going to have a very, very significant impact that is going to be very negative, especially around the issue of economic growth, around the issue of job creation. And you know, the revenue that our own state, our revenue service is actually supposed to generate. So it's not a very small thing, it's a very, very big thing. So from us as South Africans, we wish that this negotiation can succeed and things can go back to what they were before.
So, Alan, what sort of concessions can Cyril Ramaphosa offer?
I think he's boxed in. I doubt that there is a lot that he can actually give in terms of the policies, if in fact Mr. Trump's concern is the transformation policies of Mr. Ramaphosa's government, because South Africa has a history, a very terrible history of oppression, of colonialism, of apartheid, and quite a number of these legislative pieces were designed and put together largely to try and address the past injustices and the past level of dispossession. To that extent, I think that we do hope that we as South Africans, number one, because in a number of cases we hear things coming from outside, but we ourselves are divided as South Africans in terms of what are the options and the policies and the choices that we should be taking in terms of addressing those issues that relate to the past. But we can't go back to the past. We have to look forward into the future and find a way that is amicable, that can address these concerns in a way that is proper and in a way that is not necessarily going to make the system not work, because we've created this democracy now and the dividend should be able to flow to everyone else.
But Alan, surely it's been a really big blow, the fact that the Trump administration froze all US aid to the country. I mean, that was worth almost $500 million a year.
Well, absolutely. I mean, as I say, it is a very big impact. You know, one of the positive silver linings to this is that it will have to wake up South Africans in terms of its own dependence on aid. In other words, we have a lot of opportunities in South Africa. We have a lot of investment opportunities. We've got a very silent market in terms of developing the market that we have, the size of our market in South Africa. We've got the region, we've got Africa. We need to drive the investment. It isn't because there is no private capital in South Africa that is here. We've got a very vibrant democracy full of vitality. We've got one of the best constitutions in the whole world. And I think that we just need to have a mindset that says we ourselves as South Africans are going to invest in our own country. We are going to develop the skills and the competencies throughout our society so that we create a market internally. We've got to take advantage of what's happening in the region so that tomorrow we're not facing a future that is based on what the UK can do for us, what the AU can do for us, what the US can do for us. We've got the mineral resources, not just in South Africa, in the region and the continent as well. We just need to change the way we do things so that we create a future that is going to be very bright for everyone who lives here as a citizen, as well as the region, as well as the continent.
Alan, thank you. Good to see you. We'll be watching those talks at the White House today. To the UK now, where the rate of inflation has risen to 3.5% in April. That's up from 2.6% in March, according to official data. That is the highest rate in more than a year and well over the Bank of England's target of 2%. Rising energy, water and council tax bills kicked in April and add to that US tariffs that continue to disrupt and weigh heavily on economies right around the world. Tom Pugh is UK economist at the audit tax and consulting firm RSM UK.
From a consumer point of view, it's obviously pretty bad news. We've had massive increases in many of those bills. You know, we've had energy prices have been a big drag on inflation. They're now adding to inflation. We had huge increases in water bills. The price of water and sewage went up by more than a quarter. We've had those kind of increases in taxes, like on vehicle excise duty. That added to inflation. But from the Bank of England's point of view, actually, it's probably not as bad as those headline figures suggest. That's because all of the things we've just talked about are really one-off increases in taxes. They're not going to be repeated year on year on year. So when the Bank of England is looking out, you know, to 18 months, kind of 2 years away, these kind of things will drop out of the annual comparison.
In other news, the head of the computer chip giant NVIDIA says that US export controls on artificial intelligence chips to China have failed. Jensen Huang said that they had cost American companies billions of dollars in lost sales. US restrictions have spurred China to use locally developed technology and bypass international supply chains. The municipal government in Tokyo has decided to subsidise residents' water bills this summer. That's to help them cope with extreme heat. It's hoped that by reducing water payments, people will be able to afford to put on air conditioning. Japan experienced its hottest summer on record last year, with at least 260 people dying of heat stroke in Tokyo alone. Temperatures are forecast to be high again this year. Do stay with us here on the BBC. The sports news is coming up.
Soaring into the skies and beyond, Burj Azizi, the world's second tallest tower. Ambitious, glamorous, sensational. A 7-star hotel, penthouses and residences, the world's highest observation deck, cinema, nightclub and spa, world-class restaurants, a sky pool, fitness sanctuaries and more. Burj Azizi, amazing on every level.
Talking Movies is your ticket to all things film. From red carpets to the biggest film festivals. Get behind-the-scenes insights into the most talked-about films, speaking directly to the creators and stars shaping the art of cinema. We celebrate the Hollywood hits and indie gems during award season. So join me, Tom Brooke, for your front row seat to the world of film. Talking Movies, now showing on BBC News.
The news never sleeps, even when you do. A ceasefire is being called. A president is being overthrown. And trials of a new cancer drug show promise. But rest, knowing you can catch up with the restless world in your own time. The Global News Podcast brings you the stories you need to hear every day. Listen wherever you get your BBC podcasts.
Hello from the BBC Sports Centre, I'm Hugh Ferris. The Europa League final brings together two English teams desperate to save a historically bad domestic season with a trophy and indeed a place in the Champions League. Either Tottenham Hotspur or Manchester United would be one of the lowest ranked teams at home to win a European title.
We want to be at the top of everything, not only the Europa League, not only the Premier League. We want to be at the top of the FA Cup, Carabao Cup, everything we are involved. This club needs to be fighting for everything we have ahead of us. Our aim since the beginning of the season was being in Bilbao on the final, and everything we have to focus is that we have a big game, a big final, and a big opportunity to get a silverware.
While United have won trophies in recent seasons, Spurs are trying to win their first since 2008, with their captain one of those attempting to end a personal trophy drought too.
In the future, we never know. We might play next year Champions League, or we might play, I don't know, but we might play in the final. We never know, obviously. But I mean, the chance what I have now is it's real. You know, it's a fact. Tomorrow is a final of the game over Europa League final. So this could be my last chance, or this could be another chance, but I hope we can make a history day that I can never forget.
Real Madrid and England midfielder Jude Bellingham is expected to miss at least the first 6 weeks of next season when he had shoulder surgery after the Club World Cup. After having initially missed 2 games for both Madrid and England at the end of 2023, Bellingham has struggled with a persistent shoulder problem, and Real have scheduled the operation for when the tournament in the United States is over. England's cricketers embark on a huge year of Test cricket on Thursday with a one-off match against Zimbabwe. After the 4-day game at Trent Bridge, the next 2 series that Ben Stokes' side will play are against India at home and then Australia away. It is a significant test for the team and their so-called Bazball attacking style, which after some criticism has been tweaked, according to the captain.
We've been guilty in the past as a team where we've maybe been a little bit too stubborn and a bit too stuck in our ways. Whereas now we are incredibly clear on how we want to go out there and play first and foremost. We've got this understanding as a collective that it's not always going to be in our favour. There is going to be some times where we do need to reassess, and so for us it's about understanding that and really taking that and making that a precious, part of our play.
A stunning second half from Shai Gilgeous-Alexander and his Oklahoma City Thunder helped them defeat the Minnesota Timberwolves to take a 1-0 lead in the NBA's Western Conference Finals series. Trailing by 9 just before the end of the first half, the Thunder rallied thanks to Gilgeous-Alexander's 4th consecutive game with 30 or more points, and he helped Oklahoma City outscore Minnesota by 30 points in the second half to give them a 114-88 victory. Game 2 of the 7-game series is on Thursday.
To play that poorly offensively and to not get knocked out was huge. We lost the rounds, but we didn't get knocked out. And I just thought, like I said, we're going from one opponent that plays very different stylistically on both ends of the floor to an opponent that is way more free-flowing on offense and way more physical and pressure-oriented on defense. And I just thought it took us a minute to calibrate to that.
In the NHL Stanley Cup playoffs, the defending champion Florida Panthers have won up in their Eastern Conference Finals series. Their 5-2 win over the Carolina Hurricanes came courtesy of 5 different scorers in a game that came only 2 days after they wrapped up their second-round series win in Toronto. The teams head to Raleigh for Game 2 of 7 on Thursday. Much more build-up to the Europa League final. It's later in Bilbao at the San Mamés, an 8 o'clock kickoff UK time on the BBC Sport website and app. But that's it for now. Back to Lucy.
Looking forward to that match tonight. Thank you so much. Let's bring you more now on Gaza. Fida Al-Araj works with Oxfam. She has 6 children of her own, and she told me how her family and her children are doing today.
I have to say, we're much better than other families. We're just surviving. We have a little bit of food to survive on. We still not evacuated our house. So this puts us in a very rare category, better than most of Gaza residents right now.
What stories are you hearing from others who are not in the same situation as you?
Actually, like what I'm hearing, what I'm experiencing, what I'm seeing through my personal interactions, but also as a humanitarian aid worker in Gaza Strip is overwhelming. So there is 3 parts if I have to describe it, how's it going. So the first part is the increasing intensity of offensives, bombardments all the time, airstrikes, artillery strikes from the sea, it's ongoing around the clock. Casualties and injuries are very much increasing by the hour. People are directly affected. Against this backdrop, there is a huge evacuations happening. People are literally lining the streets looking for shelter, which is not available. There's no space left, which is not under restrict evacuation order, or which is not in a red area or red zone for the Israeli military operations. So people are actually just roaming the streets trying to find shelter. And the third and most prominent other thing that's happening is the starvation. Of course, food supplies are really decreasing. When I'm saying we're lucky that we have food, we're lucky to have 1 meal per day. We're lucky to have access to some grains, to some bread, but that's it.
Fida Al-Araj speaking to me a short time ago, and more developments on the BBC News website. We have a live page up and running to keep you up to date with everything that is happening right now in the Middle East, and we will of course keep across it here on BBC News. US singer Chris Brown has been freed on bail by a court in London after being charged over an alleged assault in a nightclub in 2023. The court gave the American musician permission to continue with his scheduled international tour, which includes UK shows in June and July. Let's speak to our news correspondent Greg McKenzie, who's been following this story throughout. Greg, good to see you. What were the conditions of bail?
Well, there were strict conditions, Lucy, in terms of the bail that was granted today in a London court, Southwark Crown Court. Now, just in terms of background, Chris Brown was arrested last Thursday in Manchester in the early hours of the morning by Metropolitan Police officers who were tipped off that the singer had arrived in the UK. Now, he was wanted for questioning in relation to an assault in a nightclub 2 years ago in London. So the singer had flown in to Manchester on his private jet to work on preparations for his tour. He has a number of UK dates, and it was then that the police arrested him last Thursday at 2 o'clock in the morning. He went to court the following morning, and the judge said that he was not going to grant the singer bail, and he was subsequently held on remand in a UK prison, we believe in a Manchester prison. Now, today, his lawyers have submitted successfully a bail application, and the judge at Southwark Crown Court has granted that bail for the singer on the condition that the singer pays £4 million up front and a further £1 million in the next week. Now, that is really a security deposit, if you like, so that if the singer breaks any of the conditions of that bail condition, then he would forfeit the £5 million in total. Now, as for other conditions that have been stipulated, the judge has said that he will allow Chris Brown to carry on with his UK tour dates. So he's due in Manchester, London, Cardiff, Birmingham and Glasgow, and also other dates in the US and Canada. The judge has said he will allow the singer to travel internationally, but he must provide an address here in the UK where he must reside until his next court appearance on June the 20th.
And briefly, Greg, we're seeing pictures of Chris Brown at the moment on tour. He's won a few Grammys. Tell us a bit more about his career and why he's so popular.
Well, Chris Brown is an international platinum-selling artist. He's had numbers and numbers of #1 hits, and an artist that has been in the industry for a number of decades. And many people have watched him grow from a child to a man and be quite successful. He's had a few issues in the past, which were widely reported, most famously the incident with Rihanna back in 2010. And subsequently, he had spent some time, had got prosecuted for that back in Los Angeles many years ago. But moving forward, the singer had apologized and has seemed to be getting his life back on track. And this incident 2 years ago, he's yet to answer to those charges or even enter a plea. But it's widely expected on June the 20th, when he appears at Southwark Crown Court, that he will submit a plea, and he will appear in court on the 20th of June along with his co-defendant Omalulu Akinlolu, who is a music producer. Both the pair are accused of attacking a fellow music producer at a London nightclub 2 years ago.
Greg, thank you so much. Good to see you. Greg McKenzie, who has been following this story throughout and has written the story on the BBC News live page as well. Let's just take you back to the live pictures that we've been getting in from Khan Yunis, with aid agencies warning of the rapidly deteriorating humanitarian situation there and saying those aid trucks that have been allowed, the few trucks that have been allowed in, have still not distributed any of that aid to those who are in desperate need. Matthew is here next with more from the Middle East. Stay with us on BBC News.
Hello. We've seen some very stormy weather across portions of the Midwest, the Central Plains, and that's been pushing through the Mississippi Valley over recent days. That system's still with us. It's easing in intensity, but it's still expected to bring some heavy rain on Thursday to parts of New England towards the northeast as well.
Discover Sierra Leone, a hidden gem of West Africa, where the rhythms of life dance in harmony with the beauty of nature.
Feel the heartbeat of our culture in every beat of the drum, in every step of the dance.
Experience the tranquility of our shores, where each sunrise brings new stories and endless possibilities.
Immerse yourself in the vibrant tapestry of our daily life, where every color tells a tale and every face a friend.
Come, be enchanted by the sights and sounds of Sierra Leone.
A place where your adventure awaits.
And